Okay, hello everyone. Hope I'm audible, guys. Fine. Okay, good evening, good afternoon, guys. Good afternoon. Hope I'm audible. Yes. Fine. We'll start the class. Okay, as you all know that DSM is an important subject for your exams. Okay, fine. So, what is the answer here? Okay, so we will discuss chapter-wise questions. This is the most important chapter as far as your exams are concerned. Demography. Okay, demography. Okay, what is the answer for this question? This is a chapter. It starts with demography. What is the answer? Yes, IUCD can be used for inserted as an emergency contraceptive for how long? Answer is B, guys. Normally, all other things. Okay, so we have, what are the other methods we can use, guys? What are the other methods we can use? OC pills, high estrogen OC pills, yes, mifepristone. Fourth is, what is the fourth one? We have this LNG tablet, yes, okay, LNG tablet. LNG 0.75 milligram tablet. Okay, so all these methods can be used for how long? Should be used within all these methods. Okay, all these methods, they should be used within 72 hours. Only IUCD can be used for 5 days. Remaining all the methods can be used within 72 hours. Okay, IUCD for 5 days. So 5 days is what? 5 days is 120 hours. Okay, fine. The high yielding topic, guys. Okay, we are seeing this demography first. It's a high yielding topic. Now this is IUCD, guys. IUCD maximum it can be used for 5 days. Okay, fine. What is the name this is given? Anyone? It is given in the program. What is the name of this LNG 0.75 milligram tablet? Yes, it is given under the name of easy pill. It's given under the name of easy pill. Easy pill. Okay, easy pill. Fine. Next. Answer the next question. Okay, fine. Answer the next question. Okay, it's not Antara, it's easy pill, guys. Okay, what is Antara? Since you are asking, okay, what is Antara? So we have this Antara is there. Antara is DMPA, guys. Injectable contraceptive. Injectable contraceptive, Antara. Okay, and we have this Sencroman is there. Sencroman is given in the program. It's under the name of Chaya. Okay, Sencroman is given in the program under the name of Chaya. What is the chemical that is present in Sencroman? It's called as ormeloxyfen, guys. The chemical is present here in Sencroman, ormeloxyfen. Then apart from that, we have Mala D and Mala N, guys. Mala N. Which is free of cost here? Mala N is, okay, Mala N is free, guys. Okay, fine. So these are the various drugs we use in the program, guys. Okay, contraceptive, different types of contraceptive use. Mala D and Mala N both are oral contraceptive. Answer the next question is, what is this NRR means what? Okay, NRR, net reproductive rate. What is NRR? NRR means net reproductive rate. What is the answer here? Number of female children. What is the answer here? Again, okay, wonderful guys. Okay, it is number of female children newborn girl has in her lifetime, taking into account into mortality, guys. Okay, mortality. Okay, fine. This is NRR, net reproductive rate. Okay, the four terminologies we need to know here, guys. One is, what is general fertility rate? Okay, fine. General fertility rate. General fertility rate is, okay, number of live births. Denominator is women in reproductive age multiplied by 1000. This is general fertility rate, guys. Okay, for every live births, what is the denominator? Denominator is women in reproductive age group. Right. Second is, what is same thing? Number of female children a newborn girl has in her lifestyle. Okay, based on current fertility assuming no mortality, guys. Okay, you are not taking into consideration mortality. What is it? Okay, fine. Yes, can you answer this? Girl children, current fertility and no mortality. What is this one? Okay, we saw what is NRR. We saw number of girl children based on current fertility assuming no mortality. Yes, excellent, guys. Okay, this is GRR, gross reproductive rate. Gross reproductive rate. What is the difference? Net reproductive rate, girl children, current fertility and mortality. Gross reproductive rate is girl children. Okay, girl children you have, and you are not taking into consideration. Which one you are not taking into consideration? You are not taking into consideration mortality, guys. Okay, mortality. Right. Next is, what is TFR? Third is, what is TFR? Fourth one. What is TFR? Total fertility rate. Total fertility. What is TFR? TFR is number of children born to a woman. Okay, TFR is number of children born to a woman. The target for TFR is less than 2.19. India has achieved this. We have achieved this target for TFR. TFR should be less than 2.1, which India has achieved actually. Okay, fine. What is the target for NRR? NRR should be 1. Okay, this can be achieved if couple protection rate should be 60%. Okay, NRR should be 1. Okay, the couple protection rate should be 60%. 60%. Okay, fine. This is TFR, this is NRR. Four definitions we saw: NRR, TFR, and gross reproductive rate and general fertility rate. Okay, general fertility. Answer this question, guys. Answer this question. Fine. Okay, answer the question. Okay, answer this question here. This is literacy rate, guys. This is literacy rate. Whom do we person called as effective literacy rate? Okay, whom do we call literate? Literate means more than 7 years who can read and write, guys. Okay, more than 7 years who can read and write. So we have to exclude the children, we have to exclude this. Okay, fine. So numerator is literate person. Numerator is literate persons. Denominator is population 7 years and above. Literate person also 7 years and above. More than 7 years multiplied by 100. So what is this? What is the answer here? So 10,000. These children are there. So 10,000 minus 2,000. That is 8,000. So how many people are literate? 4,000 by 8,000 multiplied by 100. So that gives you 50%. That gives you 50%. Okay. The population 4,000. 4,000 is the literate persons, and denominator is children between less than what to say. We have children. Children is between less than 6 years, less than 7 years. We have to exclude them. Okay, fine. So answer is 50%. Okay, 50%. Okay. What is the answer here, guys? Fourth question. Are you guys able to follow this? Yes or no? Shall I continue? What is true about late expanding phase of demographic cycle? What is this demographic cycle? What is demographic cycle? Okay, fine. Demographic cycle means, okay, it has 5 stages are there. Okay, 5 stages. It has 5 stages are there based on crude birth rate and crude death rate. Okay, demographic cycle is based on crude birth rate and crude death rate. Okay, fine. What are the 5 stages are there? Okay, the first stage is, first one is high stationary. Okay, high stationary. High stationary means you keep the document what we have given to you. Okay, you can use it, guys. Anyway, we will send this PDF. We will send high stationary. High stationary means country is having high birth rate and high death rate. Okay, fine. Second is early expanding. What happens in early expanding? Okay, birth rate is still high. Okay, birth rate is still high. Death rate started declining, guys. Declining. Okay, birth rate is still high. Death rate started declining. Okay, fine. This is early expanding. Third, late expanding. Late expanding means, okay, both birth rate and death rate declining, guys. Compared to previous stage. Compared to previous stage, it start coming down. Okay, low stationary. Low stationary means low birth rate and death rate. Both are low. Most of the European countries are in this phase. The last one. Declining means what? Birth rate is less than that of death rate. The number of people born in a year is less than that of number of people died in a year. Okay, so some European, Germany, Hungary are in this phase. So which phase India is currently in? India is currently in late expanding phase. Yeah. India is currently in late expanding phase. In late expanding phase. So what is the answer for the question? What is the answer here? What is the answer for the question? So the two about the late expanding phase. So both are declining, guys. Death rate started declining. Birth rate tends to fall. Okay, both are declining. Then it becomes late expanding phase of demographic cycle. Demographic cycle का late expanding phase है. Okay, fine. Next. Fifth question is, all are non-contraceptive advantages of OC pills except. All are non-contraceptive advantages. Okay, fine. So OC pills, okay, except what is it? So OC pills you can use it for different condition. Okay, OC pills, it prevents ovulation, guys. Prevents ovulation. Okay, what are the conditions it can be used? PID, ectopic pregnancy, okay, benign breast disease, It is used for benign breast disease. It is used. Ovarian system cancer, guys. Okay, ovarian system cancer it is used. And it is used for iron deficiency anemia. So which one will not come here? Which one will not come? This is hepatic adenoma, guys. Answer. Hepatic adenoma is actually a side effect of OCP. It is a side effect. Okay, hepatic adenoma is a side effect of OCP. Hepatic adenoma, MI, venous thrombosis. These are some of the side effects. These are some of the side effects of OCPs. Side effects of OCPs. Okay, fine. Hepatic adenoma, okay, MI, venous thrombosis, all are side effects. Side effect. Okay, fine. Next question. We can go into the next question. Can you calculate this, guys? 100 women followed up for 20 months with OC pills. 5 became pregnant. Calculate Pearl index. Since in your exam we are seeing nowadays calculations. Okay, previously will not be there, but nowadays since they started giving this calculator, they are asking these calculations. Can you calculate and tell me what is the answer here? The formula for Pearl index is number of accidental pregnancies by total months of exposure, guys, multiplied by 1200. Number of accidental pregnancies by total months of exposure multiplied by 1200. Multiplied by 1200. Number of accidental pregnancies by total months of exposure multiplied by 1200. Okay, multiplied by 1200. Now, so what is the answer here, guys? What is the answer here? What is the answer you will get here? This is how many became pregnant? 5 became pregnant. Okay, fine. What is the total months of exposure? Okay, 100 women, 20 months of exposure. That is for 1 woman, guys. How many women we are following? 100 women multiplied by 1200. So 60 by 30, 20, that is 60 by 20, that is 3, guys. 3. Total months of exposure. Okay, total months of exposure. Okay, so total months of exposure is how much here? Yes, it is. Okay, for 1 woman it is 20 months. How many women we are following? We are following 100 women, guys. We are following 100 women, so it is 200, guys. Okay, so you have to multiply the 20, multiply it by 100. 100 you have to multiply it. Right. So are we clear here? This is an important topic, guys. We should know these terminologies. We should know. Okay, fine. What is this niche means what? What is this niche? Niche means what? Pregnancy test kit, guys. Niche is, what is niche? Niche is pregnancy test kit, guys. Pregnancy test kit. Right, niche. Okay, fine. Niche is pregnancy test kit. Okay, fine. Next is, what is this gap means what? This is a connection problem. What is gap? Gap. It's a type of study to find the unmet needs of family planning. Okay, it's a type of study to find the unmet needs of family planning. This is niche. Niche, gap we should know. Okay, fine. Next. Antara we have seen. Okay, fine. What is this image, guys? What is this image? First image. What is this first image? Yes, it was asked in your last session, I think. This was Tippy's loop. It was asked in the last session. What about this one? 2 rings. Few years back, it was asked in some other exam, NEET exam. This is female condom. Okay, what about this one? The second one is female condom. Okay, this is female condom. Female condom. This image was asked, okay, this year in NEET exam. Okay, so we should know it. Okay, we have these 5 stages. What are these 5 stages? This is demographic cycle, guys. This is demographic cycle. 5 stages are there. We have 5 stages are there. Okay, so this one is birth rate. This one is death rate. Okay, fine. For the first stage, both birth rate and death rate are same. Okay, in second stage, birth rate is still same. Death rate started declining, guys. Okay, then third stage. Okay, high stage, early expanding, late expanding. Okay, so we should know. Okay, in second stage, birth rate is still same. Death rate started declining. Okay, fine. Yes. Next question, guys. Answer it. Okay, answer this one. Okay, first learn some formulas first. Then we'll come back to this question, guys. We'll learn some formulas. We'll come back to this question. What is infant mortality rate? Numerator is infant deaths. Live births multiplied by 1000. Okay, infant means what is the age group, guys? Infant means what is the age group? Infant means 0 to 1 year. Neonatal mortality rate. Numerator is neonatal deaths by live births multiplied by 1000. Neonate means what? 0 to 28 days. 0 to 28. Post neonatal mortality rate. The numerator is post neonatal deaths. Denominator is live births multiplied by 1000. Post neonatal deaths, what is the time period, guys? 29 days to 1 year. Okay, 29 days to 1 year, guys. Post neonatal mortality rate 29 days to 1 year. 29 days to 1 year. Okay, fine. Infant mortality rate, neonatal mortality rate, post neonatal mortality rate. Okay, TK. Now we'll go back to the question. You answer the question, guys. Okay, fine. That is post neonatal. That is late neonatal. Okay, 7 to 28 is late neonatal. 0 to 7 early neonatal deaths. 8 to 28 is late neonatal deaths. Late neonatal deaths. 0 to 7 is early neonatal deaths. 8 to 28 is late neonatal deaths. Okay, fine. Now we'll go back to the question and you answer me the question, guys. Okay, go back to the question. You answer it. Fine. Now, okay, calculate infant mortality rate. What is the infant mortality rate here? Okay, the total number of days, 56 deaths reported within the first 28 days. Okay, so that is neonatal death is how much? 56. Another 34 died between 29 days to 1 year. That is post neonatal. That is 34. Okay, so what is the formula for infant mortality rate? Infant deaths. Infant deaths means both will come. Neonate 0 to 28 days and 29 days to 1 year. So what is the denominator here? Denominator is live births, guys. Okay, what is the denominator? Live births. So live birth is, the total birth is how much? 456. Out of this, 56 were dead born, guys. So we need 456 minus 56, that is 400 multiplied by 1000. Okay, 90 for 400 multiplied by 1000. Answer is 225. Hope you are getting this. Similar problem was asked in your last exam. Similar problem was asked in your exam last time. Okay, fine. So are we clear? This is infant mortality rate. This is infant mortality rate. Answer is 225. This answer is 225. Okay, fine. Now, so what is the most common cause of infant mortality rate? IMR. What is the most common cause? Most common cause for infant mortality rate, under 5 mortality rate, neonatal mortality rate, all are prematurity or low birth weight. Okay, prematurity or low birth weight. That is the most common cause. That is the most common cause. Fine. Now, next. Okay, let us continue. Answer the question, guys. Answer the question. All of the following are minimum standards of school and its environment in India except. Okay, so minimum standards, all are minimum standards except. Okay, fine. School health checkup, whose responsibility? School health checkup is the responsibility of PHC, guys. Okay, PHC. Okay, so what is the answer here? What is the answer here? Okay, so what type of desk should have? Minus desk, that is correct. Doors and windows should be 25% of floor area, that is also correct. Okay, maximum number of students 40 is correct. One urinal should be there for 60 students and one latrine should be there for 100 students. Okay, the fourth option is wrong. Okay, one urinal should be 60 students, one latrine should be there for 100 students. Okay, 100 students. Okay, fine. Now, what is the other point? Okay, each student, fifth one, each student should have space of, 10 square feet. 10 square feet. Okay, this was also asked in your exam. Each student should have a minimum space of 10 square feet. 10 square feet space should be there. 10 square feet. Okay, for these are some of the points we should know regarding school health environment. Minus desk, 25% of floor area, 40 students, and one urinal should be 60 students, one latrine should be there for 100 students. 100 students. Answer this question. This one you should be able to answer easily. The best parameter for assessment of chronic malnutrition. Chronic malnutrition. What should come in chronic malnutrition? Yes. Weight for age and weight for height. Okay, yes, you can answer it, guys. Weight for age and weight for height indicates acute malnutrition. Height for age indicates what? Chronic malnutrition. So the answer here is height for age, guys. Okay, height for age. Answer here is height for age. Height for age. Okay, what is the criteria for SAM child? Severe acute malnutrition. SAM child, severe acute malnutrition. What is the criteria, guys? Yes. Weight for height. Okay, weight for height less than 3 standard deviation. Weight for height less than 3 standard deviation. Okay, mid-arm circumference less than 11.5 centimeter, guys. Less than 11.5 centimeters. Presence of nutritional edema, guys. Presence of nutritional edema. Weight for height less than 3 standard deviation. Mid-arm circumference 11.5 centimeter. Presence of nutritional edema, guys. Edema. Fine. This is SAM child. SAM means severe acute malnutrition. Severe acute malnutrition. Fine. Answer this next question, guys. As compared to cow's milk, human milk contains more of what? Okay, what is the answer here? Less than 3 standard deviation. Okay, as compared to cow's milk, human milk contains more of iron actually. Iron. Not less carbohydrates, iron. Okay, the bioavailability of iron is higher. Cow's milk, if you take No, not less carbohydrates, iron. More of iron. Now here, cow's milk, it is rich in protein, energy, fat. If you take cow's milk is rich in protein, energy, fat, calcium, guys. Okay, cow's milk. Human milk contains more carbohydrates. Okay, more carbohydrate, more iron, more vitamin A, C, D. Okay, the minerals also much higher. Copper, cobalt, selenium. Okay, cobalt and selenium. The answer for this question is, it is more iron. What is exclusive breastfeeding, guys? Can you tell me what is exclusive breastfeeding? Okay, what is exclusive breastfeeding? Exclusive breastfeeding means, yes, we have to start breast milk alone. Okay, give breast milk alone for 6 months. What about continued breastfeeding, guys? Continued breastfeeding should be given for how much time? Continued breastfeeding along with the other food for 2 years. Okay, last exam that was asked, exclusive breastfeeding is for 6 months, continued breastfeeding for 2 years, guys. 2 years. Okay, fine. Answer this question, guys. What are the amount of calories and proteins? Okay, fine. All of you answering very good. Just be there with me. We'll cover the whole subject. We'll cover, guys, quickly today. What are the amount of calories and proteins received by pregnant women from Anganwadi workers? Okay, this is ICDS, guys. We are talking about ICDS. This ICDS for 6 months to 5 years children. 6 months to 6 years actually. Every day you should provide 500 calories and 12 to 15 grams of protein. Pregnancy, it is D, guys. 600 calories and 20 grams of protein. How many days in a year means we have to provide 300 days in a year. Okay, ICDS should be provided for 300 days, okay, in a year. Growth monitoring will happen in Anganwadi. Growth monitoring. Okay, you have this immunization. Okay, will happen in Anganwadi, guys. Growth monitoring, immunization. All these activities will happen in Anganwadi. Anganwadi only it will happen. This place is called Anganwadi. The program is ICDS, Integrated Child Development Services, guys. Integrated Child Development Services. What is very preterm? What is very preterm? Very preterm is how much? Very preterm. Okay. So post-term. What is post-term is more than 42 completed weeks. Okay, fine. What is term? Term is 37 to less than 42 weeks. Preterm. Preterm is less than 37 weeks. Preterm. Preterm is less than 37 weeks. Okay, moderate to late preterm. Moderate to late preterm is 32 to 37 weeks. Very preterm. Okay, very preterm, guys. Very preterm. Okay, very preterm is 28 to 32 weeks. Very preterm. Extreme preterm. Extreme preterm is less than 28 weeks. Extreme preterm. Extreme preterm is less than 28 weeks, guys. Okay, fine. So post-term, term, preterm, moderate to late preterm, very preterm, extreme preterm, guys. Extreme preterm. The answer will be this one, guys. Answer will be this one. 28 to 32 weeks. Answer is 28 to 32 weeks. Okay, fine. Now, okay, what is the minimum number of antenatal visits, guys? Antenatal visits. Okay, what is the minimum number of antenatal visits as per MCH program? Okay, as per WHO, what is the ideal number of visits? Okay, ideal number of visits. Okay, MCH program, it is, how much is the minimum number? 4. WHO 8. What about ideal number of visits asked in the last exam? It will be roughly around 12 to 14 guys. Okay, maybe around 14. Okay, so roughly around 14 days. Okay, 14 it will come. WHO it is a WHO ideal is around, okay, 12 to 14 it will come. Okay, fine. Ideal, these are the minimum number of MCH program, WHO and ideal number of visits guys. What is this logo? Can you tell me what is this logo? First one. Yes, this is what? This is ICDS. This is ICDS. What about this one, guys? What about this one? It will be there in Anganwadi. It will be there in Anganwadi. Yes, what is it called as? This is called as Salter's weighing scale. Okay, Salter's weighing scale. Okay, fine. The first logo is ICDS. Second one is Salter's weighing scale. The baby will be made to sit on it. Salter's weighing scale. Salter's weighing scale. Okay. What about this one? Okay, this is what? This measures. Okay, what is this? This is Shakir's tape. Measures mid-arm circumference. Guys. Mid-arm circumference. What is the age group we should measure? 6 months to 5 years. 6 months to 5 years. 6 months to 5 years. Less than 11.5 centimeter, it is SAM child, severe acute malnutrition. Less than 11.5 centimeter, it is SAM child, severe acute malnutrition. SAM child, severe acute malnutrition. Fine. That comes in red color, guys. That comes in red color. Okay, fine. SAM child, SAM child. Answer the next question. Next question. We have 80 questions we have, so we have to cover the whole subject. Assume that, okay, subject you know. Yes. A 10-month-old child weighing 8 kg has, okay, bite-out spot in both eyes. Which of the following is the treatment, guys? Which of the following is the treatment? What is the treatment here? Okay. 10-month-old child. 10-month-old child means, so we have to provide treatment on vitamin A is 4 days, 3 days. Okay, treatment we have to provide on 3 days, 0, 1 and 14. Less than 6 months, it is 50,000 international units per dose. 6 to 12 months, 1 lakh international units. 1 lakh international units per dose. More than 1 year, it is 2 lakh international units per dose. Fine. Now, so what is the answer here? That is 10-month-old, guys. Weight is fine. Okay, 10-month-old is okay. It is 1 lakh international units, guys. 1 lakh international units per dose. So that is wrong actually, not B. The answer should be what? Answer should be D. 1 lakh international units. Okay, fine. 1 lakh international units. Orally it's given, guys. Okay, it's given orally. Okay, fine. Orally it is given. Not 2 lakh, 1 lakh international units. What is the richest source of vitamin D? Vitamin A. Richest is halibut liver oil. Second is cod liver oil. Richest is halibut liver oil. Second is cod liver oil. Okay, what is the treatment we have? What is the earliest manifestation? What is the earliest symptom? What is the earliest sign, guys? Earliest symptom is what? Earliest symptom is Earliest symptom is night blindness. What about the earliest sign? Earliest sign is conjunctival xerosis. Okay, conjunctival xerosis. Conjunctival xerosis. Earliest symptom is night blindness. Earliest sign is conjunctival xerosis. Conjunctival xerosis. Fine. Are we going okay? Are you guys able to follow this class? Or are we going fast? Yes. Class is okay. Are you guys able to follow? Or am I doing very fast? You want me to slow it up? Slow means it will take more time, guys. I think all of you are answering nicely. Yeah, fine. Pace is okay. Speed is okay. Fine. Okay, fine. What is the active principle of Letherus sativa? Letherus sativa. Letherus sativa, okay, it is, what is this? It is called as Kesari dal. Okay, fine. Kesari dal. Kesari dal. Okay, fine. I don't want to slow it up. Kesari dal. What is the chemical that is present? The chemical that is present is called as BOA. It causes neuroletherism. Neuroletherism. What is this pyrrolizidine alkaloids can cause? What is this causes? What is this causes? Pyrrolizidine alkaloids causes, okay. What it causes? It causes endemic ascites. Okay, sanguinarine causes epidemic dropsy, guys. Epidemic dropsy. Okay, so pyrrolizidine, endemic ascites, sanguinarine causes epidemic dropsy. Epidemic dropsy. Okay, fine. So this is okay. Kesari dal. Kesari dal. Okay, fine. Kesari dal. Neuroletherism, guys. Neuroletherism. Fine. Highest quality of okay mono unsaturated and polyunsaturated fats. Okay, the first is safflower oil. Second is corn oil. Okay, corn oil. Third is sunflower oil. Mono and polyunsaturated is safflower oil. Saturated fat is seen in. Saturated fat, where will you see? One is in animal foods. Okay, animal foods, palm oil, coconut oil. Okay, palm oil and coconut oil. Okay, saturated fat. Where will you find saturated fat is palm oil and coconut oil. So those are linoleic. Linolenic acid is the essential fatty acids. The most essential fatty acid. The most essential fatty acid. Okay, it is linoleic acid. Linoleic acid. That is the most essential fatty acid. Okay. Linoleic acid. Okay, fine. Yes. That means it should come from diet. Diet से ही आने पड़ेगा. Okay, fine. Yes. What is this? Diseases characterized by 3 Ds. Diarrhea, dermatitis, dementia. What is this? It is common in maize eating people. It is common, guys. Okay, it is common in maize eating people. What is this condition? Maize eating people. What is this condition? Yes, this condition is niacin. This is called as pellagra. Pellagra. So what is the name of the dermatitis you will find? The name of dermatitis, this is called as Castle's necklace. Okay, fine. The name of the dermatitis you will find here is called as Castle's necklace. It's common in maize eating people. It is common. Okay, it's called as Castle's necklace. Gesell's necklace you will find. Thiamine can cause what? Thiamine deficiency can cause beriberi, Wernicke's encephalopathy. Thiamine deficiency can cause beriberi and Wernicke's encephalopathy. Guys. Okay, encephalopathy. Okay, fine. What about riboflavin? Riboflavin deficiency can cause angular stomatitis. Okay, so riboflavin deficiency can cause angular stomatitis. It causes this angular stomatitis. Okay, fine. Niacin, we said that pellagra. It causes the condition pellagra. What about folic acid? Folic acid deficiency causes megaloblastic anemia. And I think last exam you got 2 questions from this, megaloblastic anemia. And in pregnancy deficiency, the babies can cause what? Neural tube defects, guys. Pregnancy deficiency, it causes neural tube defects. Okay, neural tube defects it causes. This is folic acid. Vitamin B12. Vitamin B12, what it can cause? Is seen only animal foods, guys. Is seen only in, not in vegan diet. Okay, only animal foods. A deficiency causes a pernicious anemia. Okay, its deficiency causes pernicious anemia. Pernicious anemia. Babies, it can cause neural tube defects. And vitamin B12 deficiency causes pernicious anemia. Pernicious anemia. Next, guys. Daily fluorine intake levels associated with the development of crippling fluorosis. Normal RDA is, it is 0.5 to 0.8 milligram per liter. More than 1.5 milligram per liter, it causes dental fluorosis. Guys, it causes dental fluorosis. 3 to 6 milligram per liter, it causes skeletal fluorosis. More than 10 milligram per liter, it causes crippling fluorosis. What is the name of the technique, guys? We do it. What is the name of the technique to remove the fluorine from the water? What is the name? Defluoridation technique. What is it called as? It is called as Nalgonda technique. Okay? Nalgonda technique. Okay, the name of the technique for defluoridation. What is it? It is called as Nalgonda technique. Nalgonda technique. Okay, fine. Nalgonda technique. These are the daily fluorine levels. Okay? These are daily fluorine levels. Okay, that can cause crippling fluorosis. What is this, guys? The first image. Anyone? Okay, fine. This first image is, this is Kesari dal actually. Kesari dal, neuroletharism, prevention by vitamin C. Vitamin C you can provide. Kesari dal. This is IAS, and this was once asked as image based question. BIS, okay, Bureau of Indian Standard. For gold and all we do. Okay, Bureau of Indian Standards for gold. Okay, gold, quality of gold checking we can do. Okay, this is Bureau of Indian Standards, guys. Bureau of Indian Standards. This is the first one is what? This is ISI. Okay? This is ISI. Vitamin C ban the crop. Okay, all are fine. All are fine. Yes. What about this one? This is soya beans. This is soya beans. This is, okay, smiling sun symbol. Smiling sun. Purpose is iodization of salt. Iodization of salt. Okay, fine. So how much iodine should be there? Okay, 30 ppm at production level, 15 ppm at consumer level. Consumer level. Okay, how much iodine should be there? 30 ppm should be there at production level, 15 ppm should be there at consumer level. Okay, fine. This is iodization of salt, guys. Iodization of salt. Okay, this is soya beans. First image is soya beans, guys. Soya beans. All of the following indicators are included. So we completed 3 chapters: demography, maternal and child health, and nutrition, guys. Okay, fine. Yes. All of the following are indicators included in PQLI except PQLI, 3 things, guys. IMR. Okay, fine. What will not come here? Answer is, what is the answer here? So infant mortality rate. So what is the answer here? Okay, all are correct here, guys. Okay, all are correct. Okay, so it comes 3 indicators. It comes. What are they? So PQLI comes 3 indicators. The infant mortality rate, life expectancy at the age of 1 year, and also what we have is, okay, literacy rate. So which one will not come here? Which one will not come here? So answer is per capita income, guys. All 3 will be part of PQLI. All 3 will be part of PQLI. What about HDA? HDA is Human Development Index, life expectancy at birth. Second is per capita income. Third, in terms of knowledge. Knowledge, we have 2 components. We have one is mean years of schooling. Mean years of schooling and expected years of school. Okay, so this is HDA. Yes, HDA. Life expectancy at birth, per capita income, knowledge in terms of mean years of schooling and expected years of schooling. Okay, fine. So India comes in which one? India comes in the rank of medium, guys. Okay, medium value. Okay, medium value. Okay, fine. So this is HDA, this is PQLI, guys. Difference between HDA and PQLI. Okay, fine. Question being asked in this NEET also, it was asked, guys. It was asked. Okay, fine. What is the answer, guys? India, it is 0.645. Values are not important, at least you should know. Action which halts the progression of disease at its incipient stage. What is this? Okay. What is primordial prevention? Primordial prevention means before onset of risk factors, guys. No risk factors are there, you are doing prevention before that. Primary prevention before onset of disease. Okay, disease. Okay, so before risk factors may be there, but disease not there. Okay, fine. This answer is secondary prevention. Okay, secondary prevention, action that halts the progression of disease. Okay, action that halts the progression of disease. That means secondary prevention we do in patients. Okay, fine. Tertiary prevention. Okay, tertiary prevention. Okay, so before the onset, primary prevention, risk factors may be there, but disease have not started, guys. Tertiary prevention means measures taken to reduce, okay, measures taken to reduce the disabilities. That is tertiary prevention. Measures taken to reduce disabilities. That is tertiary prevention. Before risk factors, primordial. Before disease, primary. Disease have started, you are trying to stop at an early stage. That is secondary, guys. Secondary, fine. So next guys, next. So we have different modes of interventions are there. Health promotion, specific protection. These are primary prevention. Primary. Early diagnosis and treatment guys. Okay, early diagnosis and treatment comes in which one? Early diagnosis and treatment. This comes in which one? Disability limitation, rehabilitation. Early diagnosis and treatment is secondary. These two are tertiary guys. These two are tertiary. Disability limitation, rehabilitation are tertiary. Health promotion, specific protection primary. Early diagnosis and treatment secondary. Okay, disability limitation, rehabilitation is tertiary guys. Tertiary. Fine. Now what comes here? The most logical sequence. The most logical sequence. What is the answer here guys? This is disability limitation disease. What is the answer here? Impairment. Impairment will lead to disability. Disability will lead to handicap. Okay, B is the answer. Okay, B is the answer. Disease, impairment, disability and handicap. Normally it goes like this. Normally it's tertiary level. This is tertiary level. Disease, impairment, disability and handicap. Handicap. Regarding disease elimination, true is. Okay, so regarding disease elimination, extermination of infectious agent worldwide, this is called as eradication guys. Eradication. Extermination of infectious agent worldwide, this is eradication. Only one disease we have eradicated. What is that? Smallpox. Okay, fine. Prevention of interruption of chain of transmission. This is the answer here. This is elimination. Elimination. What are the conditions we have eliminated? A guinea worm, leprosy, yaws, neonatal tetanus, recently trachoma. Okay, these are the diseases India has eliminated. Yeah. These are the diseases India has eliminated. Guinea worm, leprosy, yaws, neonatal tetanus and trachoma. What is this one? Reducing the disease to such a level, it's no longer a public health problem. This is the definition of disease control guys. This is the definition of disease control. Okay, we are certified free guys. We are certified free. We use the term elimination. Okay, fine. Yes. Okay, reducing the disease to such a level, it's no longer a public health problem. Okay, fine. Answer this next question. What is this? Biomedical concept of health. Okay, it's actually germ theory. Okay, what is this? Biomedical concept. What is this one? Germ theory, guys. What is germ theory? Says that if agent is there, it will lead to disease. Okay, that most of the time will not happen. Okay, biomedical concept is called as germ theory. What is epidemiological triad? Epidemiological triad for a disease to happen, three things should be there. What are the epidemiological triad means? Agent, host and environment. For a disease to happen, three things are required: agent factors, host factors and environmental factors. Agent, host and environment. Okay, fine. This is epidemiological triad. What is advanced triangle of epidemiology? Okay, what is this advanced triangle of epidemiology? Okay, so you have the same three things. Time is added. Agent is replaced with what? Causative factors. Agent is replaced with causative factors. Okay, group or population characteristics. Not just physical environment, social and cultural factors. All contribute to the disease. Social and cultural factors all contribute to the disease. This is advanced triangle of epidemiology. Causative factors, group or population characteristics, okay, environment, social and cultural factors, okay, all contribute to the disease. Okay, fine. This is advanced triangle of epidemiology. Advanced triangle of epidemiology. Answer the question, guys. Okay, answer the question. What is case fatality rate? Okay, what is the case? Small problem you should expect in the exams, guys. Case fatality rate is number of, for this example, cholera deaths divided by total cholera cases multiplied by 100. Number of cholera deaths by total cholera cases. So what will be the answer here? Okay, what is the answer here, guys? What is the answer here? Is 5 deaths by 20 cases. Okay, multiplied by 100, how much it is? 25%. Number of cholera deaths by total cholera cases. Cholera case fatality rate indicates what? It indicates virulence or killing power of the disease. Virulence or killing power. How severe is the condition? Virulence or killing power. Okay, so virulence or killing power of the disease. Virulence or killing power. Okay, fine. That is case fatality rate. Next is, what is the formula for crude death rate? Crude death rate is number of deaths in a particular time period by mid-year population. Can you tell me mid-year population corresponds to which date, guys? Mid-year population corresponds to which date? 1st of July. 1st of July. Mid-year population corresponds to which date? 1st of July, guys. Okay, 1st of July. Okay, this is crude death rate. Okay, number of deaths by mid-year population. Fine. Next. Next question. Can you answer this? In a population of 5,000 new cases, 5,000. Okay, new cases of TB is 500, old cases 150. What is the prevalence? Prevalence is number of old plus new cases by population multiplied by 100. What is the answer here, guys? Number of old plus new cases by population multiplied by 100. What is the answer here? Okay, 500 plus 150 by 5,000 multiplied by 100. 650. Answer is 13%. The answer is 13%. Okay, answer is 13%. 13%. Are you guys able to follow? Yes or no? Only nobody is answering. Yes. Okay, this is prevalence, guys. Okay, prevalence is 13%. Okay, fine. Prevalence is 13%. What is the formula for incidence? Incidence matlab kya? Incidence means, can you find incidence for this? Incidence is what is incidence? In number of new cases in a particular time period by population at risk multiplied by 1000, usually expressed in terms of 1000. Incidence usually we say in terms of 1000. Okay, incidence. Okay, same thing. New case was 500. Same problem, 500 by 5000 multiplied by 1000. So how much is this? 100 per 1000 population. That is incidence. New cases by particular time by this one. Okay, fine. What is the relationship between prevalence and incidence? Prevalence is equal to incidence into duration. Prevalence is equal to incidence into duration. More the duration, more the prevalence. More the duration, more the prevalence. Okay, for chronic diseases like diabetes, hypertension, okay, duration is higher. Okay, prevalence also higher. Incidence is not affected by duration. Occurrence of new cases does not depend upon the duration of the existing case. Incidence not affected by duration. Incidence usually is not affected by duration. Okay, duration. Okay, fine. Yes. Answer this question. Okay, answer this question. All of the following are advantages of case control study except. Okay, all of the following are advantages of case control study except. Okay, fine. Yes. What is the answer here? Okay, it is useful for rare diseases. Odds ratio can be calculated. Cost effective and inexpensive. Okay, fine. This is wrong here. Remaining all are correct. Fine. A case control study, it starts from where to where? It starts from outcome to exposure. Your exam question. Outcome to exposure. Case control study will start from outcome to exposure. What you can find in a case control study, you can find odds ratio. What you can find is odds ratio, also called as cross product ratio. A cross product ratio equal to 1 means no association. Equal to 1 means no association. More than 1 means positive association. Less than 1 means negative association. Equal to 1 means no association. There is no association. More than 1 means positive association. Less than 1 means negative association. So, who is a case control study? You select cases. Cases means people with disease. Okay, fine. So, controls means people without disease case. Okay, fine. Less than 1 is negative association of protective. Negative association of protective. For example, you select cases. Cases means people with disease. Control means people without disease. I am doing a study between smoking and lung cancer. From where I should start in a case control study? Smoking and lung cancer, you should start from, okay, lung cancer to smoking. Okay, cases means people with lung cancer, they are the cases. Controls means people without lung cancer, they are considered as controls case. Controls. Okay, fine. Okay, cases means people with lung cancer. Controls means people without lung cancer. All of the following are true regarding point source epidemic except. Is looking like this. Okay, what is wrong here? That is the question. Okay, people are getting exposed. This is number of cases. What is wrong here? What is wrong here? This epidemic curve rises sharply and falls rapidly. Okay, all cases occur in a short period of time. All cases occur within one incubation period. What is wrong here? No person-to-person transmission. Person-to-person transmission is seen in propagated epidemic. Propagated epidemic. Propagated epidemic. Okay, person-to-person is seen in propagated epidemic. Common source continuous exposure epidemic. What are the features? Common source continuous exposure, guys. Continuous exposure epidemic. What are the features? Features क्या है? इसमें common source multiple exposure. Okay, fine. Sharp rise but gradual fall. Okay, more than one incubation period. More than one incubation period. Suppose there is a contaminated well is there. Okay, contaminated well is there. People are coming fetching water from it. Contaminated well. Okay, contaminated well is there. Sharp rise, sudden increase in number of cases, but it falls gradually and more than one incubation period, guys. Okay, more than one incubation period. Okay, fine. More than one incubation period. Fine. Framingham heart study starts is an example of what study? Next question. Framingham heart study is an example of what study? Answer this. What is it? Come on, others can answer is. Framingham heart study is an example of cohort study. A cohort study starts from exposure to outcome. Okay, cohort study starts from exposure to outcome. What we can find in a cohort study? We can find incidence. Incidence we can find. Second, we can find relative risk. Formula is incidence among exposed by incidence among non-exposed. Last exam you got a question. Last June session you got a question, relative risk. Third is attributable risk. Attributable risk. Incidence among exposed minus non-exposed by incidence among exposed multiplied by 100 guys. Attributable risk. Okay, at least let us know till attributable risk. Population attributable risk little higher for you, but okay. But you should know at least relative risk and attributable risk. Incidence among exposed by non-exposed. Relative risk indicates what, guys? Relative risk indicates what? It is similar to odds ratio. What does relative risk indicates? Relative risk indicates. What does relative risk indicates? Relative risk indicates what it indicates. Relative risk indicates strength of association, guys. Strength of association. Relative risk indicates strength of association equal to 1, no association, more than 1 positive association, less than 1 negative association. Okay, equal to 1, no association, more, both are same, guys. Okay, relative risk as well as odds ratio, both indicate strength. Equal to 1, no association, more than 1 positive association, less than 1 negative association. Framingham heart study is a type of cohort study. Cohort study. Okay, fine. It starts from exposure to outcome. You are following people. You divide them into exposed, non-exposed. You follow how many people developing disease. Here also how many people developing the disease. Okay, exposure to outcome, guys. Exposure to outcome. Okay, fine. Yes. Calculate attributable risk. Calculate attributable risk. Calculate attributable risk. The incidence among smokers, we can calculate both, guys. Relative risk also, attributable risk also will calculate. First, let us calculate attributable risk. What is the formula? I said incidence among exposed minus incidence among non-exposed by incidence among exposed multiplied by 100. So how much is it? How much is it? Yes. So 10, 1. 10 minus 1 by 10 multiplied by 100, guys. What is the answer here? What is the answer? Okay, 9 by 100. This is 90%. This is 90%. Fine. Suppose the question is the relative risk. For how much is the, what will be the answer? Incidence among exposed by non-exposed. Similar one was asked in your exam. Okay, 10 by 1. Okay, that is 10. Okay, what type of association is this? Yes, this is positive association. A positive association. Okay, 10 by 1, that is 10. Incidence among exposed by incidence among non-exposed. Hope this is clear, guys. Hope this is clear. Answer the next one, guys. Efficacy of a new drug is compared with the existing drug B. Okay, fine. Answer yes. Efficacy of a new drug A is compared with the existing drug B. Drug B we are comparing. What is this? New drug is compared with the existing drug B. Yes, what is this? This is phase 3, guys. RCT. This is RCT. This is RCT. New drug you are comparing with the existing drug, that is phase 3 RCT. After phase 3, the drug will come into market. Okay, market. In market, you will be doing post-marketing surveillance. Okay, post-marketing surveillance. Okay, post-marketing survey. What is the use? Long-term side effects, guys. You will look for long-term side effects. Post-marketing surveillance. What is the purpose? Purpose is to look for long-term side effects. What is the use of phase 1? Phase 1 is to find the maximal tolerable dose. At what dose side effects will come? Phase 1. The most important part of this phase 3, that is RCT, is, what is the most important part is called as randomization, guys. Most important part is randomization. Okay, randomization. What is the use of randomization? It eliminates selection bias. It eliminates selection bias. Okay, the most important part, RCT is, okay, phase 3. The most important part is randomization. What is the advantage of randomization? Is that it eliminates selection bias. It eliminates selection bias. What is this one, guys? Next question. Time taken for 50% of patients to develop disease following exposure to this is known as what? What is incubation period? Time between entry to onset of signs and symptoms. That is incubation period. 50% of cases to happen. This is median incubation period. Suppose the organism is entering in a particular place. After how much time? 50% of cases have happened. Okay, fine. What is generation time? This year it is asked in NEET exam. Generation time is time between entry to maximum infectivity. Okay, maximum infectivity. Time between entry to maximum infectivity. That is generation time. Answering very nicely, guys. What does secondary attack rate indicates? We said that case fatality rate indicates what? Case fatality rate indicates virulence. What does secondary attack rate indicate? Secondary attack rate indicates is secondary attack rate indicates communicability. Secondary attack rate is a measure of communicability. Okay, fine. Okay, communicability. Okay, fine. Burden of disease is, burden you are saying, na? Burden is proportional mortality rate. Proportional mortality rate. Proportional mortality rate. Burden is proportional mortality rate. Okay, fine. Burden. Fine. Burden is proportional mortality rate. Secondary attack rate is a measure of communicability, how much infectious I am to others. Occurrence of disease in a haphazard and irregular pattern. What is this one? Okay, disease happening in a haphazard. There is no pattern itself. Disease happening in a haphazardly. What is this called as? This is called as sporadic, guys. This is called as sporadic. What is endemic means? What endemic means? Constant presence of disease. Okay, in a particular area, constant presence of disease. What is epidemic? Unusual increase in number of cases in excess of expected frequency, guys. Unusual increase in number of cases in excess of expected frequency. The criteria should be reported cases should be greater than mean plus 2 standard deviation. Reported criteria should be greater than mean plus 2 standard deviation. Okay, that is okay. So what is expected case number is mean plus 2 standard. Currently reported should be greater than mean plus 2 standard deviation. Greater than. What is this pandemic? Pandemic means who are more than 2 WHO regions affected, guys. Who are more than 2 WHO regions. If WHO regions are affected now. So what is the last pandemic we had? COVID. Before that, H1N1. Okay, the previous pandemic was H1N1, guys. H1N1. Fine. COVID was the last one. Before that. Fine. Efficiency of cold chain system is monitored by what? Okay, monitored. Okay, what is this VVM? VVM depends on what? Yes, VVM depends on color of the vaccine or color of the monitor. VVM depends on color of the monitor, guys. Okay, stage 1 and 2 use it. Stage 3 and 4 discard it. Stage 1 and 2 use it. Stage 3 and 4 discard it. How will you identify whether the vaccine is exposed to freeze? Freeze means, okay, what is the test? You have a test called as shake test. Shake test. Most freeze sensitive. Okay, most freeze sensitive is hepatitis B, guys. Hepatitis B, PCV, pentavalent. Okay, the most freeze sensitive is hepatitis B, PCV and pentavalent. That is the most freeze sensitive. Okay, fine. Okay, this freeze shake test. We call it a shake test. Okay, fine. So VVM to measure whether this vaccine is exposed to heat or not. Okay, freezing temperature, that is shake test. Shake test. Fine. Can you answer this question, guys? Can you answer this question? 18-month-old unimmunized child coming to the hospital for the first time. Okay, what is the answer here, guys? Okay, vaccine not more than 1 year. Some vaccine in the program we should not give more than 1 year, guys. What are the vaccine we should not give more than 1 year? BCG, pentavalent, hepatitis B, IPV, rotavirus, PCV. These are the vaccines you cannot give more than 1 year of age. Okay, so now tell me what is the answer here. The first option BCG is the second option, again BCG is the third option. Okay, so answer is okay. So these vaccines you can give till 5 years. So you can give till 5 years. DPT up to 7 years. DPT you can give up to 7 years. OPV measles vitamin A up to 5 years, guys. Okay, 5 years. 5 years you can give this vaccine. Okay, so DPT up to 7 years. OPV measles vitamin A up to 5 years. What is this open normally? JE up to 15 years. That is correct. JE up to 15 years. Normally, once open, it has to be used within 4 hours. Used within 4 hours. What are the vaccine we have to use within 4 hours? 3 vaccine, guys. BCG, MR and JE. These 3 vaccines you have to, once you open it, has to use within 4 hours. Remaining all vaccine the national immunization schedule. Remaining all the vaccines. Remaining all vaccines in national immunization schedule can be used for 4 weeks, guys. 4 weeks once open. These 3 vaccines are used within 4 hours. Remaining all the vaccines can be used for 4 weeks. What are the vaccines? Well, under the term called as open vial policy. Under open vial policy, remaining these vaccines can be used for 4 weeks. We can use, guys. Okay, we can use it for 4 weeks. 4 weeks we can use. Okay, fine. Next. 4 weeks. Okay, fine. The cold chain failure is greatest at which level? We carry the vaccines from regional level, district level, PHC level. Okay. The greatest risk of cold chain failure. Okay, fine. Where is it? It is at subcenter and village level. Subcenter and village level. Okay, because why? We will carry here vaccine carrier, guys. We'll use vaccine carrier. You have to use 4 ice packs. What is the ideal temperature in cold chain? Ideal temperature is +2 to +8 degrees Celsius. That is the ideal temperature. Where will you store the vaccine in PHC? You will store the vaccine in PHC. Where will you store the vaccine? Okay, you will store it in ILR, ice lined refrigerator. Okay, you will store the vaccines in ILR, ice lined refrigerator. What is the name of the thermometer to check the vaccine? What is the name of the temperature? We have a thermometer called as dial or stem thermometer. Dial or stem thermometer will be there. They will measure the temperature of the vaccine. Temperature of the vaccine. Right. Vaccine derived polio virus are mostly due to what? So we have this check twice daily. That is fine. So VDPVs are outbreaks are mostly due to VDPVs. Okay, VDPVs are mostly due to type 2. We have one more condition is there, that is VAP, that is because of type 3. VAP because of type 3. VDPVs are because of type 2. VAP is because of type 3. That is why currently we are giving bivalent OPV 1 and 3. We don't give 2 plus IPV we are giving. This concept is called as the switch. Okay, the switch. We are going from, initially we are giving trivalent OPV. Now we are giving only bivalent OPV, guys. Bivalent OPV plus IPV. This concept is called as the switch. The switch. Okay, fine. Yes. Vaccine not given at birth. Okay, fine. So what is the vaccine not given at birth? So at birth is, what are the vaccines we will give at birth? At birth, what is the vaccine we are going to provide? So you are going to provide BCG, OPV, hepatitis B. So what is the answer here? DPT. The answer is DPT. Okay. So 6 weeks, 10 weeks, again 14 weeks we have. 6 weeks what we are going to provide? Penta 1, OPV 1, Rota 1, IPV 1, PCV 1. So Penta 2, OPV2 Rota 2 14 weeks, Penta 3 OPV3 Rota 3 IPV2 PCV2. Okay. These are the vaccines. These are the vaccines you will provide. Okay, 9 months you will provide what? 9 months MR1 JE1 guys. MR1 you will provide, JE1 you will provide. JE1 vitamin A, okay, IPV PCV booster guys. Okay, these are the vaccines you will provide in the first year guys. These are the vaccines you will provide in the first year. These are the vaccines you will provide. Okay, MR1 JE1 vitamin A, IPV and booster dose. Okay, these are the vaccines first year. These are the vaccines you will provide. Right. So these are the stages I told you. 1, 2, use it. Okay, this is, what is this? VVM guys. This is VVM. This we have to see. 3 and 4, discard it. Okay, discard it. You can discard it. Which vaccine is given intradermally in the program? BCG and IPV guys. BCG. Which vaccine is given subcutaneously guys? Which vaccine is given subcutaneously? Subcutaneously what we are going to provide? MR and JE. OPV Rota. Oral. OPV is 2 drops. Rota is 5 drops. OPV we are going to provide 2 drops. Okay, Rota is 5 drops guys. Okay, 5 drops. Okay, fine. Yes. This is what I was saying, switch. Okay, bivalent OPV you will be giving 1 and 3. But IPV is all 3 strains you will provide. This was asked in your exam guys. IPV is given all 3 strains. Bivalent is 1 and 3. Okay, and IPV is all 3 strains. It was asked in your exam. Okay, I think Jan session, I think, or the previous years. Okay, fine. Yes, IPV is given in all strains. The time between the first possible point of detection. Okay, at 40 questions we will take a break guys. 10 minutes break we will take. Okay, fine. Period between, okay, possible point of detection, possible point of diagnosis. What is this time called as? Yes, this is called as lead time. This is called as lead time. The time between possible point of detection, usual time of diagnosis. Okay, fine. So what is this screening time? Screening time is the time between, okay, first possible point and final critical point of detection. Final critical point. After this, even if you make diagnosis, that is not going to change the outcome guys. Okay, that is called as screening time. First possible point and final critical point. Okay, that we call it as screening time. That we call it as screening time. What is the formula for positive predictive value? Answer this question. 38. For calculation of positive predictive value, denominator. Okay, fine. For positive predictive value, true positives by denominator, all are positives. All are positive. Okay, fine. Negative predictive value, true negatives, denominator, all are negatives. All are negative. Okay, everything is negative. Okay, so answer is this one guys. What is the formula for sensitivity? Can you tell me what is the formula for sensitivity? Sensitivity is true positives, denominator is true positives, and exact opposite of it. What is it? False negatives multiplied by 100. Specificity, ability of the test to identify true negatives. true negatives, denominator is true negatives, exact opposite. False positives multiplied by 100. Okay, false positives multiplied by 100. What is the relationship between prevalence and positive predictive value? Can you tell me? What is the relation between prevalence and positive predictive value? Prevalence and positive predictive. Prevalence is directly proportional to positive predictive value. Prevalence is directly proportional. Okay, directly proportional. Multiple times asked question here exam, guys. Prevalence is directly proportional to positive predictive value. Directly proportional. Okay, fine. Answer the next question. When people are screened for their own benefit, what is it called as? When people are screened for own benefit, this we call it as, what is this? Prescriptive screening, guys. Prescriptive screening. What is prospective screening? When people are screened for others' benefit. Okay, for others' benefit. Okay, others' benefit, that is prospective screening. Example is immigrant screening. Okay, so immigrant screening. You are being screened for others' benefit. You go to other country, they will screen you. Okay, this is immigrant screening. Okay, fine. High risk screening means screening high risk people. High risk screening is screening high risk people. Multiphasic screening means using multiple tests to screen. Okay, so using multiple tests to screen. Using multiple tests to screen. Are you from Madras Medical College? No, I studied from 𝐒𝐿𝐴𝐻 Medical College. Okay, fine. So multiple tests to screen. Example is master health checkup, guys. Master health checkup. Okay, so they will use this, all these different types of screening methods they will use. Okay, master health checkup, guys. This is master health checkup. Okay, fine. So prescriptive screening is screening for others' benefit. You are being screened for others' benefit. So the prospective screening for others' benefit. Prescriptive is own benefit. Okay, fine. Normally screening is secondary prevention. The question being very specifically asked, prospective screening is an example for primary prevention. Normally screening is secondary prevention, but if the question they very specifically ask, okay, prospective screening, then it is a primary prevention. Yes, it is a primary prevention. Normally it is secondary prevention. Normally secondary, but question is very specific. Normally secondary prevention. Okay, fine. Yes. Okay, fine. If one person examines, okay, so if one person examines a blood smear and finds malarial parasite, while second person examines and finds it, what is this called as? They won't ask, man. They won't ask. Let's focus here. Okay. Now, this is what between two people, guys. Between two people means inter-observer variation. Inter-observer variation. Intra-observer variation. What is intra-observer variation? I am giving a ECG to you. Same ECG in the morning and the evening. Morning you are saying normal. Evening you are saying abnormal. What is this? You are giving two different results. Intra-observer variation is between, you are giving two different results. This is intra-observer variation. Okay, fine. So, what is biological variation? Biological variation are also called as intra-subject variation. Okay, biological variation also called as intra-subject variation. Example is BP, guys. Okay, what we will do is that BP with single reading we are not going to say anything. what we will do is that repeated measurements over a period of time. Repeated measurements over a period of time. Okay, so intra-subject variation. So how will you control intra-subject variation? Intra-subject variation we can control it by repeated measurements over a period of time. Repeated measurements over a period of time. 4:45 will take a break, guys. Okay, 4:40, 15 minutes will take a break. Yes. 10 to 15. False about chicken pox. What is the answer here, guys? What is false about chicken pox? Okay, fine. So all are right, guys. Symmetrical, centripetal rash, palms and soles are not involved. Pleomorphism, scabs are not infective. What is the mode of transmission? Chicken pox is droplets, guys. What is this pleomorphism means? What? All the stages of rash you can find. Okay, macule, papule, pustule, everything you can find, guys. All the stages of rash. Centripetal rash only. Center of the body it will affect, guys. Center of the body. The incubation period for this condition is 14 to 16 days. Okay, what other things you will find is dew drop appearance will be there. Dew drop appearance will be there. Okay. If you want to do isolation for cases, isolation of cases should be done for 6 days. Do we have vaccine for this condition? Yes, we have a vaccine is there. 𝐒𝐿𝐴 strain. Live vaccine. After the vaccine, avoid salicylates for 6 weeks. It can cause what? You have to avoid. Following the vaccine, you have to avoid salicylates for 6 weeks. Otherwise, it can cause what? It can cause a condition called as Ray's syndrome, guys. So Ray's syndrome. Okay, so avoid salicylates for 6 weeks. Otherwise, it can cause a condition called as the Ray's syndrome, guys. Ray's syndrome it can cause. Okay, fine. Yes. This is about chicken pox, guys. Chicken pox. Okay, fine. True about measles. True about measles. What is true here? What is true here? Okay, fine. True about measles, all except, guys. All except. Okay. All are right, guys. All are right. The first one. Complex spots. Okay, so incubation period of 10 to 14 days. Okay, incubation period of 10 to 14 days. Okay, complex spots. Okay, it is the feature opposite to first or second lower molar tooth. Okay, opposite to first or second lower molar tooth, 1 to 2 days before rash, guys. Okay, 1 to 2 days before rash, not after rash. That is the pathognomonic feature. Opposite to first or second lower molar tooth, 1 to 2 days before the rash. Okay, fine. So do we have vaccine? Okay, most common complication. Otitis media is the most common complication. Okay, most dangerous complication. What is this? Most dangerous complication is pneumonia, guys. Pneumonia. Okay, any exposed child within 3 days of exposure, within 3 days of exposure, you can give measles vaccine, guys. Okay? Any child. Okay, SSP is late and rare complication. SSP is late and rare complication. Okay, mother is bringing an exposed child. Okay, to you. Okay, within 3 days of exposure means you can provide vaccine itself. We can provide this vaccine will prevent the natural disease. Okay, unimmunized child coming to you for the first time, mother is bringing the child, and this child is playing with my neighbor's child. The neighbor child is having measles. This is exposed child. Okay, fine. Okay, then you can provide this condition. Okay, so we will stop with this. 15 minutes break we will take. Shall we start at 5 sharply? I will also have a cup of tea. That is okay. Another 38 more questions are there. Sharply we will start, guys. Okay, sharply we will start. Fine. Okay, fine. Am I audible, guys? Hope I'm audible. We shall start. Okay, fine. Now, all of the following are regarding congenital rubella syndrome. True, except. Okay, it is diagnosed. Okay, what is the answer here? So, congenital rubella syndrome, what are the components of it? Okay, deafness, sensory neural hearing loss, cardiac malformation, and cataract should be there. It is diagnosed when IgG antibodies at 6 months is there. It diagnosed infants have IgM antibodies at birth. This is also correct. This is also correct. Okay. What is wrong here? What is wrong here? Wrong here is this one is wrong here. Infection after 16 weeks of gestation results in major congenital deformities. Okay. When usually you will find major congenital abnormalities? When will you find? So you will find 0 to 16 weeks of gestation. This is gestation, guys. Gestation. Okay, you will develop CRS, congenital rubella syndrome. 16 to 20 weeks deafness will be there. More than 20 weeks, no abnormalities. Okay, more than 20 weeks means no abnormalities. 0 to 16 weeks congenital rubella syndrome. 16 to 20 weeks deafness, and more than 20 weeks there is no abnormalities. Okay, what is the option here given is that, okay, infection after 16 weeks major abnormalities. This statement is wrong. Remaining all are correct. This statement is wrong. Infection after 16 weeks of gestation results in major congenital defects. This is wrong. Fine. Which of the following is true regarding, okay, influenza? Okay, what are the points regarding influenza? Influenza is caused by this 𝐒𝐿 Remember the H1N1, guys. Okay, hemagglutinin neuraminidase. Okay, fine. Asymptomatics are rare. No, asymptomatics are common. Okay, pandemics are also common. Incubation period of 1 to 4 days. The answer is it affects all ages. It affects all ages. Okay, according to the old book, it is 18 to 72 hours. The new edition of Park, it has come almost 2 years, guys. 2 years, it is 1 to 4 days. Now, what is the drug of choice for influenza? Okay, why these pandemics happen? Pandemics happens because of a concept called as antigenic shift. Birds and pigs, they are the main reservoir, guys. Birds and pigs, they are the main reservoir. Okay, and what is the drug of choice? Excellent, you answered it. Treatment is oseltamivir. Treatment is oseltamivir. Treatment is drug of choice oseltamivir. What is the strain for bird flu? What is the strain for bird flu, guys? What is it for bird flu? Bird flu, what is the strain? Bird flu, it is H5, okay, N1 or H7N9. Okay, H5N1 or H7N9. No person to person transmission. Okay, no person to person transmission. That is bird flu. H5N1 or H7N9, no person to person transmission. This is bird flu, guys. Okay, bird flu. What is the treatment of choice for diphtheria carriers is? Treatment of choice for diphtheria carriers. Okay. What is the diphtheria cases means? Patient come with membranous patch with bull neck appearance, guys. Okay, this is a case. A case of diphtheria case. Okay, membranous patch with bull-neck appearance. The patient's lymph node will be enlarged. Okay, this bull-neck appearance. Okay, what is the symptoms? What is the treatment for this? You have to provide penicillin. Second, you have to provide antitoxin, guys. Antitoxin 20,000 to 1 lakh international. So the question is, what is the treatment of choice for carriers? For carriers, it is erythromycin. Okay, for treatment of choice for diphtheria carriers is erythromycin. Okay, fine. Erythromycin is also given for treatment of whooping cough. Okay, whooping cough, the treatment is erythromycin. Okay, membranous patch will be there and lymph node enlargement will be there. Diphtheria, membranous patch and lymph node enlargement. The main source of diphtheria. What is the agent? Agent, you know that it is Corynebacterium diphtheriae. The main source for diphtheria. Main source is carriers. Main source is carriers. Immunization does not prevent carrier status. Immunization does not prevent carriers. Because what is the vaccine we provide? We are providing toxoid. If we are providing vaccine is toxoid, guys. Immunization does not prevent carriers. Immunization does not prevent carriers. Penicillin plus antitoxin. Penicillin plus antitoxin. Answer the next question, guys. Okay, fine. What is this condition? A 10-year-old child, 10 months old child brought to PHC with a history of cough, cold, and examination is having a respiratory rate of 48 and no chest indrawing. What is your answer? What is your answer? Fine. Now look here. We will be counting the respiratory rate, guys. Why pneumonia? Okay, respiratory rate we will count here. Based on this, we will say whether fast breathing is present or not. Fast breathing is present or not. Okay. 0 to 2 months, it should be more than 60. 2 to 12 months, it should be more than 50. 1 to 5 years, it should be more than 40. Okay, fine. This is one. Second is the chest indrawing. Okay, chest indrawing. Third is danger scent. You will look for danger scent. Stridor, convulsions, abnormally sleepy, those things we will look for. In this child, this is 10 months old child. This is 10 months old child. And respiratory rate is only 48. It's not 50, guys. It's less than 50. And there is no chest indrawing. There is no chest indrawing. There is no danger sign. Nothing is this. Then what is this? This should go as no pneumonia. Go as no pneumonia. Okay, respiratory rate is 0 to 2 months more than 60. 2 to 12 months more than 50. 1 to 5 years more than 40, guys. 1 to 5 years more than 40. Then what is this? This is no pneumonia, guys. We are going to call this as no pneumonia. Less than 50. So what is the treatment for pneumonia? Color coding, what we will follow. What is the color coding we will follow? Okay, no pneumonia means you will follow green color coding, guys. Green color coding. Pneumonia means yellow color. Severe or very severe pneumonia, what we are supposed to follow? You should follow with pink color coding. We have to follow pink color coding. Okay, fine. No pneumonia, green color according to IMNCA. So pneumonia, what is the drug of choice? Pneumonia, it is amoxicillin, guys. It is amoxicillin. Pneumonia, it is amoxicillin. Amoxicillin is pneumonia, guys. Pneumonia. Color of patient wise boxes in, not ampicillin, guys. Amoxicillin. Amoxicillin. For severe or very severe, you can say of ampi plus genta, you can say. Severe or very severe pneumonia, you can say ampi plus genta. But here it is only amoxicillin. What is the color of patient-wise boxes for category 1 in TB, guys? The question is in TB. TB is, it is red color, guys, red color. What is the drug here? Okay. What is the component of this? So we have this 2-phase, 2-HRZE, 4-HRE. Okay, 2-HRZE, 4-HRE. Okay, fine. For drug monitoring, we are using this concept called as 99 dots. Okay, drug monitoring. Patient mobile number is attached. Okay, so from the registered mobile number, on the back side of the drug strip, they will have the toll-free number will be there. They have to give a call. That is 99 dots. One is 99 dots. Second, we have this 𝐒𝐿𝐿 is there. Online portal. Online portal is there. 𝐒𝐿𝐿 is there. Okay, fine. 𝐒𝐿𝐿. And recently, we also have this 𝐒𝐿𝐿 portion Yojana. 𝐒𝐿𝐿 portion Yojana. 500,000 rupees per month. Recent change is there. 1,000 rupees per month is given for 6 months. Okay, 1,000 rupees per month for 6 months, guys. Money is given. This is 𝐒𝐿𝐿 portion Yojana, guys. 𝐒𝐿𝐿 portion Yojana. 1,000 rupees per month for 6 months. 6 months. Okay, fine. Yes. Color of the patient-wise box is category 1. Guys. Category 1 is red color. What is MDR-TB? Can you tell me MDR-TB? I'm not very going deep, but I'm focusing what is being asked in your exam. MDR means HR resistance. HR resistance. Pre-XDR-TB means HR resistance plus fluoroquinolone resistance. Okay, fine. XDR-TB means HR resistance, fluoroquinolone resistance plus what is the third resistance? XDR, extensively drug resistant. Okay, they are resistance to bedaquiline, also called as linezolid. Okay, linezolid. Bedaquiline or linezolid. Okay, bedaquiline or linezolid. Okay, this is XDR resist, not vancomycin, bedaquiline or linezolid. Linezolid also you have to add. Okay, fine. For this MDR-TB, recently government has launched this new drug called as treatment called as BPOM. Okay, recently government has launched this BPOM treatment for the treatment of MDR, guys. What is BPOM means what? Bedaquiline plus pretomanid plus linezolid plus moxi for 6 months duration, guys. For 6 months duration. Very recently, guys. Very recently, last 10 days, last 10 to 12 days, we have this new drug BPOM. Bedaquiline, pretomanid, linezolid, and moxifloxacin. 10 to 20 days. Last 10 to 20 days, we had this. Okay, fine. Recently. For MDR regimen, bedaquiline, pretomanid, linezolid, and moxifloxacin. Okay, moxifloxacin for MDR treatment, MDR drug treatment. Okay, fine. Yes. A case of AFP, acute flaccid paralysis, must be observed for how many days? Okay, so two things you will do whenever you are seeing a case of AFP. AFP, which age you will check? AFP, acute flaccid paralysis, you will check less than 15 years. You will collect 2 stool samples. Okay, 2 stool samples you will check, and you will look for residual paralysis. At 60 days you will check. Okay, at 60 days, not 30 days. Okay, residual paralysis will check at 60 days. 60 days you will check. 60 days. Okay, whether the child is still having paralysis or not. Less than 15 years, 2 stool samples you will collect. Okay, 2 stool samples you will collect, and residual paralysis you will check at 60 days. AFP is 15 years. Pulse polio immunization, how many years? Pulse polio. Pulse polio is how many years? Pulse polio is okay, less than 5 years to be vaccinated. Okay, we will be having this pulse polio days. We will have on this particular day all children less than 5 years to be vaccinated, irrespective of their previous immunization status. Irrespective of previous immunization status, they should be vaccinated. Okay, fine. All of you are having very good knowledge, guys. Just keep it up, be focused. Okay, you will clear the exam easily. Fine. Next question, guys. Next question. A 5-year-old boy passed 18 stools in last 24 hours, vomited twice in last 4 hours, is irritable but drinking fluids. What is this? What is this? You will see 4 things. Any child with diarrhea, general condition you will see. Second, sunken eyes. Third is thirst. You will offer water to this child, thirst. Fourth is you will do skin pinch test. Where will you do the skin pinch test? We will do it in the abdomen. Okay, fine. Now here they said that, okay, baby looks irritable. The general condition looks baby irritable, but they are drinking fluids. Okay, fine. We out of these 4 conditions, we are having 2 conditions. Okay, 2 conditions. Okay, this corresponds to some dehydration. This corresponds to some dehydration. Okay, so general condition, everything is fine means no dehydration. Baby looks irritable, drinking fluids is there. Okay, fine. Then it becomes some dehydration. What is the treatment for some dehydration? Some dehydration, it is ORS. ORS. Okay, we have ORS. Okay, baby is lethargic, unconscious, not able to drink. Okay, skin pinch test takes very slow time. Then it is severe. This is ORS. This is some dehydration, ORS. What is the ORS which you use is 245 milliosmoles. This is WHO reduced osmolarity ORS. 245 milliosmoles. Okay, this is WHO reduced osmolarity ORS. Reduced osmolarity ORS, which is what we are using it now. Okay, what is additionally will give all child with diarrhea along with ORS? What will you give extra? We'll give one more thing to all the children. What will we give is plus we will add zinc, guys. Zinc we will. Okay, we'll provide zinc for every child. We'll provide zinc. Zinc we will provide. Okay, zinc you will provide. Fine, fine. Next question, guys. In a community with 1 lakh, okay, in a community with 1 lakh, okay, 20,000 slides have been examined in a particular year. Out of these, 100 were positive for malarial parasite. What is the APA? The formula for annual parasite incidence, APA is confirmed cases by population at risk multiplied by 1000. How much is the confirmed case? Confirmed case is 100. What is the population at risk? 1 lakh multiplied by 1000. So answer is 1. Confirmed cases by population at risk multiplied by 1000. One more is the called as annual blood examination rate. Annual blood examination rate. What is this annual blood examination rate? This is number of slides examined. Number of slides examined by. I'm giving questions, certain things which you are not usually seen. That's why I added this question. Since we are getting problems, okay, they might ask this. That's why I added some more problems to this your test paper. Number of slides examined by population multiplied by 100. How much is the number of slides examined? 20,000. What is the population? 1 lakh. So 20,000 by 1 lakh multiplied by 100. This is 20%. This is 20%. Okay, number of slides examined. This is 20%. Okay, number of slides examined by total population. This is annual blood examination rate. Okay, these are the two important indicators, guys. Two important indicators. So we have two more is there. Just we should know what is the two more says. One is this infant parasite rate. Infant parasite rate. What is infant parasite rate? Infant parasite rates talks about recent malaria transmission. Recent malaria transmission. Infant parasite rate says recent malaria transmission. Okay, fine. Third. What is spleen rate? Spleen rate is, it talks about endemicity of the disease. Okay, endemicity of the disease. Spleen rate. Spleen rate talks about the endemicity. Okay, what is the endemicity of the disease? This is given by spleen rate. Okay, spleen rate. Okay, fine. So these are the points we should know, guys. These are the points we should know regarding this. Okay, infant parasite rate and spleen rate. This. Okay, fine. Yes. Answer the next question. To eliminate filariasis, Government of India launched. What is this answer here? What is this? For filariasis, we are having this annual mass drug administration. So we are using this DEC plus albendazole once a year for 5 years. Okay, we use this. Okay, DEC means diethyl carbamazine, albendazole once a year for 5 years. What is the vector for filariasis? Filariasis, it is 𝐒𝐿𝐹. Yes, 𝐒𝐿𝐹. 𝐒𝐿𝐹. We have one more Murugan filariasis is there. For Murugan filariasis, what is the vector, guys? For Murugan filariasis, it is Mansonia. Okay, so this is the normal filariasis, Bancroftian filariasis. This one is normal one. This is okay, Bancroftian. For Bancroftian filariasis, it is 𝐒𝐿𝐹 fatigans. Okay, 𝐒𝐿𝐹 fatigans. For Murugan filariasis, it is Mansonia. Okay, fine. The DEC, ivermectin, albendazole. We used albendazole. Ivermectin is there, but not for this purpose. Ivermectin drug is available, but for annual mass drug administration, we don't use ivermectin. We don't use ivermectin. What we use is DEC plus albendazole, not ivermectin for annual mass drug administration. It is available there in the program for treatment purpose, not for this purpose. What is this vector, guys? Image based question that is asked in your exam. This is the only mosquito. This is Anopheles, guys. Okay, Anopheles is breeds in fresh water. Okay, breeds in fresh water. What disease it transmits? Malaria. This is the only mosquito that will sit like this with an angle. Okay, fine. What about this one? This sits with hunchback, guys. This sits with hunchback. Okay, so no stripes. This is 𝐒𝐿𝐹, guys. This is 𝐒𝐿𝐹. Okay, 𝐒𝐿𝐹. Okay, it breeds in dirty water. Okay, it breeds in dirty water. What disease it transmits? 𝐴𝐸 filariasis. 𝐴𝐸 filariasis. Hunchback, no stripes, 𝐒𝐿𝐹, breeds in dirty water, 𝐴𝐸 filariasis. Okay, fine. This is AIDS, guys. Okay, AIDS. AIDS, okay, hunchback, plus stripes is there. Hunchback plus stripes is there. Okay, this mosquito, what does it do? Okay, this mosquito breeds in artificial containers. Okay, it breeds in artificial containers. Yeah, tiger mosquito. 𝐒𝐿𝐿𝐿𝑥 is also called as nuisance mosquito. 𝐒𝐿𝐿𝑥 is nuisance, tiger mosquito, Aedes is tiger mosquito. Where this mosquito breeds? It breeds in, okay, where this mosquito, Aedes mosquito, where it will breed? It breeds in, okay, artificial container. What disease it transmits? Dengue, chikungunya, yellow fever, Zika virus. Okay, dengue, chikungunya, yellow fever, and Zika virus. Rift Valley fever is also there, not in India. Okay, dengue, chikungunya, yellow fever we should know, Zika virus. What is this one? It's a hairy insect, guys. What is this? Sandfly. It looks hairy. A hairy insect, sandfly. What disease it transmits? Okay, what disease it transmits? Yes, it transmits Kala Azar oriental sore, guys. Kala Azar and oriental sore. This is sandfly. Okay, you get image based questions. What are the disease it transmits? Like that also will get questions, guys. Okay, fine. Kala Azar and oriental sore. What is the correct schedule for post exposure treatment of person who are vaccinated for rabies previously with human diploid cell culture? The person is already vaccinated. Person is already vaccinated means, okay, fine. So, for example, any person with a dog bite, okay, wound management should be done. The wound management is 15 minutes running water, guys. Okay, 15 minutes running water, you wash it, clean the wounds. Okay, fine. No suture for 24 to 48 hours. No suture for 24 to 48 hours. Okay, don't do suturing. Then based on the needs, you can provide TD and 𝐒𝐿𝐿𝐿𝐿 antibiotic. Then you can vaccinate it. Okay, based on the needs. Okay, categorize the wound. Based on the need, you can categorize it. Okay, fine. We have two regimen is there. One is essence regimen 0, 3, 7, 14 and 28 days. 5 doses IM, guys, 0.5 ml. This is essence regimen. Okay, updated Thai regimen is there. Updated Thai regimen 0, 3, 7 and 28 days. Okay, this is 0.1 ml intradermal, but every time if you are giving, you have to provide in 2 sites, guys. Okay, the second one is updated Thai regimen. The first one is, what is the first one? First one is essence regimen. Essence regimen you have to provide. Okay, fine. So this is following a dog bite. Here the question is, the person is already vaccinated, the human diploid cell culture. So what is the schedule here? Already vaccinated means only 0 and 3, guys. Essence regimen we don't follow, guys. Okay, essence regimen we can follow it for in a private hospitals we can do. We can follow private hospitals. You will not get patients. Okay, you will not get patients. So you can follow that. You can follow that. IM regimen you can follow. But government hospitals you will follow essence updated Thai only you will follow. Okay, government hospitals. Okay, that's more easier actually. Okay, fine. Pre-exposure prophylaxis you want to provide. What is pre-exposure prophylaxis? Pre-exposure prophylaxis is 0, 7, 0, 7, 21 or 28 days. 0, 7, 21 or 28 days. That is pre-exposure prophylaxis. Okay, fine. Yes. All of you are answering very good, guys. Very good. Fine. What is the international quarantine period for yellow fever? Okay, so yellow fever quarantine period usually done for the longest incubation period. Quarantine period is So yellow fever incubation period is 3 to 6 days. So what is the answer? 6 days. Yes, okay, 6 days. Yellow fever, it is 6 days. Now, so what is the vaccine we have? We have a vaccine 17D strain. If you are given this vaccine 17D strain, they will provide the certificate. Yellow fever certificate they will provide. The validity of certificate starts from 10 days to lifelong, guys. Yes, 10 days to lifelong. The validity of certificate starts from 10 days to lifelong. 17D yellow fever certificate validity starts from 10 days to lifelong. 10 days to lifelong. Okay, fine. Now, so we have this no Aedes breeding around seaports and airports for how much distance? Seaports and airports. So it should no breeding for how much distance? 400 meters, guys. No breeding around seaports and airports. Okay, seaports and airports, no breeding for 400 meters. There should not be any breeding, guys. Okay, fine. No breeding. Okay, for 400 meters. Next is what is this IE stat? Not 500, doctor. 400 meters. What is this IE strategy? IE strategy means, okay, elimination of yellow fever epidemic strategy. Elimination of yellow fever. WHO is following this strategy. Elimination of yellow fever epidemic strategy. Okay, that is okay. That we call it as IE strategy. This we call it as IE strategy. Fine. A woman traveling from Bihar to Delhi, suspecting to have Kala Azar. What is the investigation? What is the investigation you can do? Yes. Yes. What is the investigation? For Kala Azar, patient will have fever and splenomegaly. You will go with 𝐒𝐂𝐃39 kit, guys. What is the drug of choice, guys? What is the drug of choice? 𝐒𝐂𝐃39 kit. What is the drug of choice? If it is positive, the drug of choice is liposomal amphotericin. Liposomal amphotericin B. That is a drug of choice, guys. That's a drug of choice. Fever, splenomegaly is there from these endemic areas. A person from Bihar, UP, okay, West Bengal, Jharkhand. These are the 4 states that are endemic for Kala Azar. Bihar, UP, West Bengal, Jharkhand. If anybody is coming with these places, fever and splenomegaly for more than 2 weeks, you have to rule out Kala Azar, guys. Kala Azar. Now, a person has received complete immunization against tetanus 10 years ago. Now he presents with clean wounds, lacerations. Okay, what to do? Okay, fine. So we will divide like this. Wound less than 6 hours clean wounds, more than 6 hours unclean wounds. You have to ask immunization. When you have taken vaccine last? Less than 5 years, 5 to 10 years, more than 10 years, unimmunized. Less than 5 years means whatever type of wound, nothing is required, guys. Nothing is required. Whatever type of wound, nothing is required. Here 1 dose, here 1 dose. Okay, more than 10 years also 1 dose only. But you have to add immunoglobulins, 2 doses, again 2 doses, plus you have to add immunoglobulin. Both these situations you have to add immunoglobulin, otherwise it's same, guys. Okay, in both these conditions you have to add immunoglobulin only you have to add. Okay, now you go back to the question and tell me what is the answer, guys. Okay, go back to the question and tell me what is the answer. Okay, so 10 years ago, now it's a clean wound, guys. It's a clean wound. Clean wound means they will come here. This scenario they are coming. So what is the answer? Single course of TT. Single course of TT. Okay, single course of TT. Yes. In multibacillary cases, adequate follow-up should be done by. Okay. So multibacillary cases, okay, follow-up should be done yearly for 5 years. Paucibacillary cases, paucibacillary it is 2 years. Multibacillary it is 5 years. Paucibacillary it has to be 2 years. Okay, what is multibacillary? 6 or more than 6 lesions. Paucibacillary 5 or less than 5 lesions. What is the treatment? Rifampicin, dapsone, clofazimine. Okay, this is monthly, this is daily, this is also daily for 12 months. Here rifampicin, dapsone. This is the current treatment what we are giving, guys. Rifampicin monthly, dapsone daily. This is for 6 months. Okay, the 3-drug regimen what we are giving currently is only for multibacillary. Paucibacillary still in the program, only 2-drug regimen. Okay, fine. This one 3-drug regimen is given right now for WHO. Okay, for WHO says that paucibacillary for 6 months, multibacillary for 12 months. Okay, multibacillary for 12 months. This is for WHO regimen. For WHO regimens, okay, paucibacillary for 6 months, multibacillary for 12 months. Okay, but as of today, what we are giving is only in our program. Our program we are giving only 2 drugs. Guys. Only 2 drugs we are giving for paucibacillary. Okay, rifampicin, how many days we are giving? The rifampicin monthly and dapsone daily, guys. Dapsone daily. Okay, fine. Am I clear, guys? Okay, hope this is clear. A pregnant lady was found to be HIV positive in the first trimester. According to current guidelines, what is the treatment? A pregnant lady, if she is positive, whenever she is positive, what is the treatment, guys? What is the treatment? Immediately start lifelong ART, guys. Yes. From the point of diagnosis, immediately start lifelong ART. What is the 3-drug we will provide? TLD, tenofovir. I'll write here. Tenofovir plus lamivudine plus dolutegravir. Tenofovir, lamivudine plus dolutegravir. For baby, you will provide what? Baby, you will provide nevirapine, guys. Okay, syrup nevirapine for 6 weeks. Okay, for baby, TLD you will provide. For baby, you will provide, okay, syrup nevirapine. Syrup nevirapine will provide for 6 weeks. You will provide tenofovir, lamivudine plus dolutegravir. You will provide. Okay, fine. Okay, lifelong. For adult also same. Okay, for adult, HIV positive adult. Okay, same concept. Is baby will not provide anything. There is no baby. HIV positive adult also same concept, TLD. From point of diagnosis, you have to provide TLD, tenofovir, lamivudine and dolutegravir. Immediately, irrespective of CD4 count and clinical staging, you are going to provide the treatment. Fine. Yes. Following symptoms are included in syndromic approach of sexually transmitted disease, except which one will not come? Genital ulcer disease itself, 3 will come. Okay, 3 genital ulcer disease, GUD, penicillin allergic, okay, GUD painful. Okay, then what we will develop? Lower abdominal pain will be there, and one more will be there. What is this? Inguinal buboes, guys. Inguinal buboes. 2 for penicillin allergic. Okay, fine. So what is the color coding we will follow? Okay, urethral discharge we will follow syndromic approach, gray. Vaginal discharge, green. This is white color kit, blue color kit, red color kit, yellow and black. Okay, so white color for genital ulcer disease. Patient is allergic means blue, penicillin allergic. Okay, red color. Okay, then yellow for lower abdominal pain. Inguinal buboes means it is black, guys. Okay, it is black. This is the clinic, guys. Okay, for STD we have this STD clinic has been renamed as Suraksha Clinic. Okay, STD clinic has been renamed as Suraksha Clinic. All these are color coded. This is inguinal buboes, lower abdominal pain, vaginitis, okay, urethral discharge. Okay, urethral discharge. Okay, this is painful GUD. Okay, fine. So this is what? Blue color. Okay, this is GUD, guys. G. Okay, fine. Patient is penicillin allergic means we can provide this. Okay, fine. Yes. Now, are we clear? This is syndromic approach. This is syndromic approach. What we have seen so far. Next. What is this one, guys? What is this? Both are asked in this NEET exam. Okay, what is this one? Logo. What is this one? This is National Leprosy Eradication Program logo. This is the for leprosy. We have a mascot is there. Okay, so Sapna. Okay, this was asked this year, image based question, NEET exam, guys. Okay, National Leprosy Eradication Program, and Sapna is for leprosy. She is to create awareness. Okay, school going girl creating awareness regarding leprosy, guys. Regarding leprosy. So we have completed communicable disease, guys. We have completed communicable disease. Let's see the remaining areas. All of the following sites used to measure skin fold thickness to assess obesity. Okay, the instrument what we have is called as Herpendon's calipers. Herpendon's calipers. Okay, fine. Mid triceps, biceps, subscapular. What we will not measure is not anterior abdominal wall. We will measure fourth one is suprailiac. Okay, suprailiac, guys. Okay. Why everybody is saying triceps? Okay, so mid biceps, triceps, subscapular and suprailiac. Which one will not come is anterior abdominal one. So the instrument name is Herpendon's calipers. More than 40 millimeter for boys, more than 50 millimeter for girls. This is obesity, guys. Okay, more than 40 millimeter for boys. Okay, and more than 50 millimeter for girls is considered as obesity. Okay, you just measuring skin fold thickness. No issues. Okay, fine. So one of the group when I'm taking online class, you are answering very good. Okay, seriously I'm saying. Last week only I had a class 2-3 days back on FMGE class. Okay, I know how the students are. Okay, you are answering really well. Just keep doing it. Fine. What is the formula for BMI? BMI is weight in kg by height in meter square, guys. Weight in kg by height in meter square. That is BMI. Weight in kg by height in meter square. Okay, fine. Now this is BMI. We will do this. Okay, waist circumference. Waist circumference equal to or greater than 1 or 2 centimeter for males. Okay, equal to or greater than 88 centimeter for females is obesity, guys. Obesity. Okay, so weight is equal to or greater than 1 or 2 centimeter for males, 88 centimeter for females. Right. Waist hip ratio more than 0.9 actually for males. for males, more than 0.85 for females is considered as obesity. More than 0.9 for males, more than 0.8 for females is obesity. Right. What is tracking? What is the purpose of tracking? I don't know whether you had the image. Tracking is like this. Those children having low blood pressure will have low blood pressure. Okay, fine. This is children, guys. This is time. Okay, time. This is time. BP. Okay, fine. These children. So identifying children. What is this? Answer is. So what is the purpose of tracking? Is identifying children at risk of hypertension. At risk of hypertension in future date. Identifying children at risk of hypertension in future date. That means these children in high blood pressure child means definitely in adult also they will have high blood pressure. Okay, fine. So this concept is called as tracking. Okay, so you can start some preventive measures. Low blood pressure tend to be low, high blood pressure tend to be high. This is tracking. What is the other concept? Rule of halves. Rule of halves is also associated with hypertension. Okay, rule of halves, that is also hypertension. What does the rule of halves says that? It says that what does it say? It says that okay, it's a highly asymptomatic disease, guys. 50%, only 50% of people know that they are having hypertension. Among them 50% will be on treatment. Okay, among them 50% is adequately treated. Okay. So diagrammatically we can see 50% of the people know that they are having hypertension, know their status. 100 hypertensives are there means only 50% know their status. Among them 50% on treatment. The last 50% is on adequate treatment. Okay, adequate treatment. So 50% will know their status. Among them 50% will be on treatment. Among them 50% will be adequate treatment. This was asked once. The last circle, what is this? This smallest circle is adequately treated. This was asked in the exam. The smallest circle was asked in the exam. This is rule of halves. This concept is called as rule of halves. Risk factor for cervical cancer increased by the following. Which one has risk factor? Early marriage. So cervical cancer, early marriage, early coitus. Okay, early marriage, early coitus, multiparous women, it is common. Okay, multiparous women, it is common. OCP usage, it is common. It's not upper socioeconomic status, it is lower socioeconomic status. Okay, fine. What is the investigation you will do? You can do pap smear. Second, you can do VAA, yes, VAA, visual inspection after application of 50% of acetic acid. VAA, visual inspection after application of 50% of acetic acid you can do. Okay, fine. This is risk factor. This is risk factor for cervical cancer. Okay, fine. Now, cost effective is VAA. VAA is cost effective only. Pap smear also you can do, but VAA used in the program, guys. Our program we will do. Okay, program we will do. Okay, fine. The program. What is the most common cancer in India? What is the most common cancer in India among males, females, overall, guys? What is the most common cancer among males, females and overalls? Okay, can you answer this, guys? Yes. Try to answer. Males, oral. Females, breast. Overall, breast. Most common cancer in India is breast cancer. It is the breast cancer. Okay, fine. Most common cancer. Name the program launched for increasing quality of labor room care. What is this program, guys? What is this program? Program launched for increasing quality of labor room. What is the answer here? Answer is Lakshya. Okay. What is JSSK? JSSK is free OPD, free treatment, free blood, free transport for pregnant mothers and sick infants. For pregnant mothers and sick infants. Okay. Everything is free. Free OPD, free treatment, free blood. Ayushman Bharat is health insurance. We will provide health insurance, Ayushman Bharat. Okay, health insurance. How much is the coverage? 5 lakh per family per year, guys. 5 lakh per family per year. What about PMSMA, Pradhan Mantri Surashit Matritva Abhiyan? This one we will provide, okay, free antenatal clinics on 9th of every month. Free antenatal clinics on 9th of every month. Okay, free antenatal clinics, 9th of every month. We are providing free antenatal clinics. Purpose is to identify high risk cases. Okay, identify high risk cases. Okay, identify high risk cases. Okay, purpose is to identify high risk cases. Free antenatal clinics on 9th of every month. Every month. Okay, fine. Next, guys. Okay, we can go into the next one. Okay, fine. Yes. NSSK program. This was asked in your exam. Guess what is this? NSSK program. NSSK program was basic newborn care and resuscitation. Basic newborn care and resuscitation. NSSK program. Okay, resuscitation. Okay, fine. What is this RBSK? A child screening and early intervention. Child screening and early intervention. Okay, 0 to 18 years children you are going to screen. Okay, 0 to 18 years you are going to screen. Child screening and early intervention. Okay, fine. Under RCH emergency obstetric care, what is the criteria for first referral unit? It's a commonly asked question. What is the criteria for first referral unit? Can anyone tell me what is the criteria? FRUs. What is the criteria for FRUs? Okay, you should have blood bank should be there. OT should be there. What is the third one? Third one should be anesthesia facilities should be. Anesthesia facility. So we have these things are there. It is called as FRUs, guys. FRUs, first referral unit, blood bank, OT, anesthesia facilities should be there, guys. Anesthesia facilities should be there. Asha's duty include. Okay, you tell me the answer, I will tell remaining things. One Asha should be there for every 1000 population. Okay, what is Asha duty? 1000 population, 25 to 45 years, resident of village. Okay, she should be resident of the village, guys. 25 to 45 years, and we studied up to 10th standard. Studied up to 10th standard. Yes, what is it? What is the main job Asha? Asha's job is to promote which program Asha belongs to. Not Usha and all, leave Usha and all, guys. Okay, fine. Okay, Asha main job is which program? JSY, Janani Suraksha Yojana. Our main job is to, okay, so escort all pregnant mothers for hospitals. He has to promote institutional delivery. Institutional delivery she has to promote. Institutional delivery promotion. He has to make women come deliver in the hospital. No Usha and all. You stick on to ASHA. Everywhere it's ASHA only. Okay, fine. So escort all pregnant women for hospitals. She has to accompany them. She has to accompany them. Okay, fine. So if ASHA will be there for every 1,000 population. Fine. Color coding for IMNCA. Now already we have seen the colors, guys. What is the color coding for IMNCA? Yes, what is the color coding? Yes. Green means home treatment. Green means home treatment. Yellow means OPD treatment. It's not yellow, actually it's pink, red, pink. This is pink means pre-referral treatment and referral, guys. Pre-referral treatment and referral. Pre-referral treatment and referral. Okay, pre-referral treatment and referral, guys. Referral. It's not red. Okay, it's not red. Don't go with red. Okay, probably for flow chart it will be difficult. Red color. That's why they went for pink. Okay, green home treatment, yellow OPD, pink is pre-referral treatment and referral, guys. Fine. What is this 6x6 matrix? This matrix in anemia, Mukt Bharat, guys. Okay, 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. Okay, these are the 6x6 matrix. Okay, 6 beneficiaries are there, 6 intervention, 6 institutional mechanism. For pregnant women, we are giving 60 milligram of elemental iron, 500 microgram of folic acid for 180 days. Lactation also same tablet for 180 days. So before delivery 180 days, after delivery we have to provide 180 days. PMJ we have seen it, 5 lakhs coverage, and Ayushman Bharat 5 lakhs coverage. Okay, coverage per family, health insurance, PMJ. Pradhan Mantri Jan Arogya Yojana. Pradhan Mantri Jan Arogya Yojana, we are doing this. Okay, fine. This is PMJ. PMJ, Pradhan Mantri Jan Arogya Yojana, guys. Fine. JSSK, full form was recently asked. JSSK, Janani Sishu Suraksha Karyakram. We already seen it. Free OPD, free treatment, free blood, free transport. Okay, fine. This, what is this one? Pradhan Mantri, okay, Surakshit Matritva Abhiyan. Okay, what is this related with? Yes, this is related with free antenatal clinics on 9th of every month, guys. Free antenatal clinics on 9th of every month. Fine. Yes. What is the minimum recommended chlorine for routine water? What is the answer for this, guys? Chlorine demand is found by RX apparatus, guys. RX apparatus. Then you are going to add the water to the chlorine to the water. You are going to add the water to the chlorine. Okay, you are going to add. Okay, the minimum contact period should be how much? It should be 60 minutes. Okay, fine. And how much residual chlorine should be there? 0.5 milligram per liter. Okay, so minimum residual chlorine should be, answer should be contact period of 1 hour and 0.5 milligram per liter. What is the name of the test to check what is chlorinated? Test is orthotoluidine test, orthotoluidine arsenite test. Okay, orthotoluidine test, orthotoluidine arsenite test. For drinking water, it is 0.5 ml, guys. Okay, for swimming pool, what you are saying is for swimming pool. Okay, swimming pool it is, okay, 1 milligram per liter, guys. Swimming pool it is 1 milligram per liter. Okay, for drinking water it is 0.5 milligram. For swimming pool you require higher doses. Higher doses 1 milligram per liter, guys. Okay, so for swimming pool. Able to follow, guys? Shall I continue? Okay, fine. So all are indicators of air pollution. Okay, fine. What are the indicators? Soiling index is there. Grit index is there. Suspended particle SO2, CO2, carbon monoxide, methane, all are indicators of air pollution. Okay, fine. Okay, fine. What is this one? McArdle's index. McArdle's index measures the maximum allowable sweat rate. How much sweat is acceptable? That is given by McArdle's index. Okay. Out of this, which is the best indicator of air pollution? For air pollution, best indicator is SO2, guys. Sulfur dioxide. Second is smoke. Okay, the best indicator. Best indicator is sulfur dioxide. Next is smoke. Smoke is the next best indicator. Best indicator of air pollution is sulfur dioxide. Next is smoke. Optimum floor space per person. Less than 50 square feet. Nil, guys. Nobody should be there. 50 to 70 square feet, half person. 70 to 90 square feet, one person. 90 to 100, 1.5 person. More than 110, 2 persons. More than 110, 2 persons. Who is considered as half count? 0 to 1 year, no count. Okay. 1 to 10 years, half count. 0 to 1 year, no count. 1 to 10 years, half count, guys. Okay, 1 to 10 years, half count. Okay, fine. 1 to 10 years is considered as half count. So what is the answer here? So for an adult person, answer is 70 to 90 square feet, guys. 70 to 90 square feet. Yes. This last exam also this was asked. Which is considered as the heart of the activated sludge process? So the answer here is aeration tank. Okay, this is sewage treatment plant. What is sewage means? Sewage means wastewater with excreta. Sludge means wastewater without excreta. That is sludge, guys. Wastewater without excreta. Okay, look here. The sewage treatment plant, it goes like this. Okay. So first there will be metallic rods will be there. Then you will have grid chamber will be there. Then you have this sedimentation tank. Primary sedimentation tank will be there. Then you have this activated sludge process. Okay, then you have this final sedimentation tank will be there. Okay, final sedimentation tank. Okay, then it goes for final disposal, guys. Final disposal. The metallic rods, grid chamber. Okay, sedimentation tank will be there. Activated sludge process. That is the question, which is considered as the heart of this activated sludge process. Okay, that is aeration tank, guys. Aeration tank. Aeration tank is considered as the heart of the sludge process. According to WHO, the most insanitary method, okay, of waste disposal. Here they are talking about solid waste dumping, guys. Dumping. Okay, dumping. Burial is used for as a disposal for camps and all. Solid waste disposal in camps. Okay, fine. Best one is controlled tipping. It has various methods will be there. Area, ramp, trench method, guys. These are the various methods will be there. If land is available, this is the best method, guys. Okay, if the land is available, this is the best method. Land is available. Okay, most insanitary method is dumping. Burial means you can use it in the camps. Okay, deep burial. You are going on a trip, you're generating solid waste, you're generating, okay, you can go for this, okay, you can go for this deep burial you can do. Controlled tipping, okay, all the corporations and municipalities, they will go for controlled tipping. If land is available, they will go for controlled tipping. What is this one, guys? Image based question. This year it was asked. This is Carter's thermometer, measures cooling power of air. Carter's thermometer, it measures cooling power of air. What is this one? This is sling psychrometer, guys. Sling psychrometer. What does it measures? Sling psychrometer measure humidity. It is asked in your exam, I think last year, or the Jan exam it was asked. Okay, it will be kept like this in hand, it will be rotated. You will measure the humidity, you will measure. Okay, sling psychrometer. What is the use of anemometer? Anemometer measures air velocity. Okay, anemometer measures air velocity. Okay, what is the purpose of anemometer? Anemometer measures air velocity. Air velocity. Okay, fine. What is this one? This is called as 𝐒𝐿𝐴𝐻 apparatus. 6 white cups will be there, 1 black cup will be there. This is 𝐒𝐿𝐴𝐻 apparatus. Measures chlorine demand of the water. 𝐒𝐿𝐴𝐻 apparatus, it measures chlorine demand of the water. This is chloroscope to check the chlorine level. Okay, that is ortho-tolerant test I said. No, this is chloroscope. Okay, this is chloroscope, guys. Chloroscope to find the chlorine, how much chlorine is there in the water. Yellow color changes will be there. Okay, yellow color changes. Yellow colors, it will be there. If chlorine is there, the water will turn into yellow color. Yellow color. This is chloroscope. Chloroscope. Next graph, guys. Biostatistics, few questions. The scatter diagram is drawn to study what? Okay, scatter diagram is drawn to study what? They will use to study the relationship between two given variables. Okay, whenever you are showing the analysis, okay, between you have two variables, are the age is there, age and body weight is there, okay, or we can use it for your exam marks and amount you time spent on social media. Okay, I want to show correlation between two variables. I want to show correlation, I can show. What is this? This one indicates what? Option A. Option A will tell you what, guys? Option A. Option A, trend of the variable over a period of time. This is given by line diagram. Is given by line diagram. Trend is given by line diagram. Trend is given by line diagram. Line diagram. The incidence of malaria they have given. Okay, tell me what is the answer here. Question is answer. Okay, what is the answer here? This is okay. Mean. Mean means what? Average. Average is affected by extreme values or outlier. What is the answer here? We have outlier is there, okay, because we have 10 is there, 5000. Then we should go for median. What is median means? Median means middle value. Arrange the data in either ascending or descending order. Middle value. What is mode means what? Most repeated value. Mode means, what is mode means? Most repeated value. Which data comes again and again, that is mode. Median is the middle value. Median is the middle value. Okay, fine. But mean is affected by extreme values. Okay, if there is outlier is in the data, it was asked in your exam. Okay, outlier in the data, then you have to, okay, go far away from it. You should not use mean. Okay, you should not use mean. Mean bone density. Okay, fine. So what is the test? You can use it. The test of significance. This test of significance. First, you have to see the data, guys. Bone density, is it measurable? Yes. Let's see for quantitative data. Quantitative data. Quantitative data, two groups are there. Two groups means student t-test or unpaired t. Only one group is there, before and after. Okay, there is only one group is there, before and after. Then it is paired t-test. Then it is paired t-test. Okay, look at the formula. Look at the question. The question is what? Mean bone density. Is it mean bone density is measurable? Yes, it is measurable. Still, if you have confusion, the clue is there. Mean is there. Mean standard deviation is there. That means it is what? Quantitative data. So, how many groups are there? Two groups. So, what is the answer here? The answer here is student t-test. First, you have to see the data, guys. What is the data? How many groups are there? Okay, fine. If it is qualitative, what is the answer? Qualitative. Question says percentage or proportion. The question says percentage or proportion. You can think of qualitative. Two groups are there. Commonly asked one is chi-square test. Chi-square test. Okay, two groups are there. Two separate groups are there. We can go for chi-square test. Chi-square test. Are we clear? The data. First, what you have to see is data. Second, what you have to see, how many groups are there? How many groups are there that you have to see, guys? Okay, fine. Yes. What is this graph, guys? It was asked in your exams. Two variables are compared side by side. Yes, what is this? This is multiple bar chart. Okay. Two or more than variables compared side by side. You are comparing side by side. You are comparing, guys. Two or more variables side by side. Okay, fine. What is the next graph, guys? What is the next graph? This one. What is this one? This is pie chart. This is pie chart. This is pie chart. Okay, fine. The entire circle corresponds to 100%, guys. Entire circle corresponds to 100%. This is pie chart. Pie chart. Okay, fine. Pie chart. What is this one? This is called as component bar chart. Okay, component bar chart. There is space is there. Look here, space. You are comparing variable within the bar itself. Comparing variables within the bar. Within the bar itself, you are comparing. You are comparing the variables within the bar itself. You are comparing. This is pie chart. Okay? This is not component bar chart. Component bar chart. There is no space here. Cholesterol I am measuring. What is this cholesterol? Cholesterol I am measuring. So what is this one? This is histogram, guys. This is histogram. Cholesterol. This is measurable data, quantitative data. This is histogram, quantitative data. Remaining three, what we have seen is for qualitative data. Histogram, the quantitative data, measurable means we can go for histogram, guys. Histogram. It's measurable data, we can go for histogram. Safety officer to be appointed where number of workers are more than. Okay, so Factories Act says that Factories Act 500 cubic feet space should be there. Okay, 500 cubic feet for 1000 workers. What is the answer, guys? For 1000 workers, we require one safety officer. For 500 workers, one welfare officer should be there. One welfare officer. For 250 workers, one canteen should be there. Okay, for 30 mothers, you require a creche. Okay, less than what year, that is banned? Less than 14 years, banned. Okay, less than 14 years, that is banned. Banned from the working place. Okay, less than 14 years, that is banned. Okay, so what is the answer here? Safety officer should be for how much population? Safety officer should be for every 1,000 workers. For 1,000 workers, safety officer. The most common manifestation of asbestos exposure is pleural plaques. Yes, pleural plaques. This lower lobes will be affected. Asbestosis. Okay, lower lobes will be affected. Lower lobes will be affected. What does the X-ray will shows? X-ray shows ground glass appearance. Okay, X-ray will show ground glass appearance. Okay, lower lobes are affected. What does X-ray will show? X-ray will show ground glass appearance. Common in cement workers. Cement workers, it is common. Okay, silicosis. Upper lobes will be affected. Upper lobes will be affected. Snowstorm appearance. X-ray, if you see, snowstorm appearance. X-ray. X-ray, if you take snowstorm appearance. Piscinosis is common among whom? And bagasosis happens because of what? Okay, piscinosis happens because of why piscinosis happens, and bagasosis why it happens. Piscinosis, cotton fibers, guys. Everybody looking tired, huh? And what about bagasosis? Yes, what about bagasosis? Bagasosis, it is sugar cane dust. Okay, bagasosis is sugar cane dust. Sugar cane dust. Fine. Piscinosis, this is cotton fibers. Bagasosis is sugar cane dust. Waste disposal of placenta. What will you do? Placenta. Okay. Chemical waste. Chemical waste is there. Blood bags. Okay. Medicine. Discarded drugs. Okay. Discarded drugs. All these should go to yellow color bin. Yellow color bin. Okay, yellow color bin. If yellow color bin means it should go for what? Incineration. It should go for incineration. Yellow color bin. Now, what about these things, guys? Gloves, syringes, okay, Ryle's tube, catheter. This should go to which color bin, guys? This should go to which color bin? This should go to, okay, Ryle's catheter, Ryle's tube, catheter, all this should go to red color bin, guys. Okay, they should go to red color bin. Red color bin. What about needles, blades, okay, vials, pacemaker. Needles and blade should go to, needles and blade, they should go to white, guys. Okay, pacemaker and vials should go to blue color. Blue color should go. Ryle's tube, gloves, syringes, catheters, they can go for red color bin. Red color bin, they can go, guys. Okay, they can go for red color bin. Okay, fine. Yes. During massive disaster, what we should do? During massive disaster, we should focus on, yes. Okay, we should focus on search, rescue and first aid. Search, rescue and first aid only we should do. What is the triage we will do? Okay, triage means, red means high priority. Color coding we will be doing at, color coding we will be doing. Okay, first search, rescue, first aid only, guys. Okay, fine. Red. Yellow means what? Green and black. Yellow means medium priority. Green means ambulatory. Black means dead, guys. Black means dead. Okay, so you are classifying injured people based on the chance of survival, guys. Okay, you are classifying injured people based on the chance of survival. Where will you do the triage? Okay, in the hospital or in the site of disaster? Triage usually should be done at the site of disaster, guys. Yes, triage should be done at the site of disaster. What we should not do? No mass vaccination, no mass chemoprophylaxis. Following disaster, you should not go for no mass vaccination and no mass chemoprophylaxis. No mass chemoprophylaxis. Okay, fine. First step is search, rescue and first aid. Okay, so response phase, relief phase, rehabilitation, mitigation and preparedness will come. Okay, fine. Yes. All are grassroots level workers. Okay, except who will not come here? The answer is health assistant. Remaining all the people are at grassroots level. Sub-center. Okay, rural area we will see. Okay, rural area. Sub-center normally will be there for what is the population? Okay, 5,000. Hilly area 30,000. PHC normally 30,000. Hilly area 20,000. Health assistant will be there in the PHC, guys. That is why they are not grassroots level workers. CHC. Okay, CHC will be there for 80,000 to 1.2 lakhs, guys. Okay, CHC will be there for 80,000 to 1.2 lakhs. What about in urban areas? Recently some changes came. Okay, all these centers are converted into health and wellness centers. Health and wellness centers. All the sub-center PHC, okay, they have to be converted into health and wellness centers. They said that health and wellness center, sub-center in urban area should be there for 15,000 to 20,000 population. PHC, it is health and wellness center PHC should be there for 50,000 population, 50,000 to 60,000 population. THC will be there for what population? THC will be there for 2.5 lakhs to 5 lakhs in metros. THC will be there between 2.5 lakhs to 5 lakhs in metros. These are some of the new changes, guys. Okay, in your last exam, this was asked. What is the population of urban PHC? Urban PHC is 50,000. This was asked in your last exam. Okay, fine. Last July exam, it was asked. Okay, fine. All are grassroots level workers except. So, Anganwadi workers, TBA, village health is nowadays they are not there. Now, what we have is ASHA only we have. All these people are there, okay, at village level, but health assistant will be there at PHC. What is workshop? Workshop is series of 4 or more meetings with hands-on training. Okay, with hands-on training, for example, BLS workshop. Okay, BLS workshop means basic life support workshop. 4 to 8 experts, they will sit and discuss in front of audience. This we call it as panel discussion. Okay. Discussion between 6 to 12 members, this we call it as group discussion. Series of speeches, this is called as symposium. This we call it as symposium. Discussion between 6 to 12 members, that is called as group discussion. That we call it as group discussion. Series of speeches on a given topic, that we call it as symposium. That we call it as symposium. Symposium we will say. And where we use these spikes? Can anyone tell me where we use these spikes? Okay, spikes we use this, okay, for teach students on the way of communication skill, breaking bad news, how to talk to people. Okay, we are teaching MBBS students. Okay, so how to talk to students. This is breaking bad news. Okay, this is breaking bad news. Okay, symposium spikes is breaking bad news. Okay, hands-on training, BLS workshop, guys. I think this is the last question. UNICEF Gobi campaign, O stands for what? Okay, O stands for what? O stands for, okay, oral rehydration therapy. Okay, so G stands for growth monitoring, O for ORS, B for breastfeeding, and I for immunization. UNICEF also contributed to India's applied nutrition program, guys. Okay, they also contributed to India's applied nutrition program. They contributed UNICEF nutrition program of India. Okay, SIDA is an international agency where they contributed SIDA for TB program of India. TB program. DANIDA, they contributed in India for blindness control program. Blindness program they contributed, DANIDA. And Ford Foundation, these are your past questions on I'm writing. Ford Foundation, they contributed for Ford Foundation, they contributed for rural toilets, rural area toilets construction, they contributed this. Okay, Ford Foundation, Ford Foundation. And we have this Colombo plan. NEET exam it was asked, they contributed. What is Colombo plan? Colombo plan they contributed for cobalt plant development. Okay, cobalt plant development. Okay, fine, they contributed this. Okay, they contributed cobalt plant development. Okay, fine. So we have completed. So you will get this PDF. Okay, it will be uploaded on Telegram channel, guys. Hope you learned from this. I think most of you are answering nicely. Okay, so very happy about it. Okay, so keep studying. If you have any queries, okay, otherwise thanks for listening, guys. Okay, thanks for listening. We try to cover as much topic as possible. Am I audible? Okay, guys, thank you. If you have any queries, you post it. Otherwise, thank you, guys. Thank you. Thanks for listening. Thank you, guys. Thank you. Okay, all of you are actively participating. Okay, I'm very happy for it. If people have a lot of knowledge also, okay, so keep studying. Okay, so it should be helpful. You should clear the exams, do your internship, get PG. Okay, okay, see you soon in PG classes. Okay, fine. Thank you. Thank you.